So thank you for coming and just welcome everyone to the National Academy of Medicine Climate Communities Network's first ever public event, leveraging data to drive effective heat protection policies. My name is Anthony Nickum, and I'm an Environmental Justice Fellow at the Association of American Medical Colleges and the Climate Communities Network strategic partner and co-lead for the group that planned this convening. I'm really excited to serve as your MC for today. So we're really beginning the event today with the Policy 101 session. And as a reminder, this session is a primer for the main event, which will begin at 1 p.m. Please note that this meeting is recorded and we will share the recording and slides on the NAM event page in the coming days. We are delighted to welcome Carrie Ann Lee, Director of Climate Policy and Appropriations at Pioneer Public Affairs and Executive Director at Build America Policy Council, who provide a foundational overview of policy, the policy process, strategies to influence policy, and the meaningful ways to engage with decision makers. Over to you, Carrie.
Thank you, Anthony, and thank you all so much for joining us today. Really excited to talk to you a little bit about the policy process and let you and a little bit of the lay of the land. As Anthony mentioned, I'm the Director of Climate Policy and Appropriations at Pioneer Public Affairs. We're a clean energy, clean tech, climate solutions government relations firm based in DC. I'm also the Executive Director of Build America Policy Council. And we're a network of state and local government experts mobilizing states to move the needle on national efforts. Prior to both of these things, I was a Hill staffer for a New Jersey Congresswoman in the House of Representatives. We can go to the next slide. So here we're going to quickly as best we can cover a couple of topics, one being the lawmaking, rulemaking, and appropriations process, very high level. All these topics are enough to fill a college semester's course worth of stuff. So we're going to do some pretty broad brush strokes generalizations, but I hope that you'll be able to walk away with a better understanding of how this process works. I also want to set you all up for success in the advocacy space. So looking at how to get started, who you want to reach out to, what type of engagement you want to do, how to plug into the rhythms of DC and the importance of your work, and then send you out with some tips and tricks once you get your foot in the door, what you say. We can go to the next slide. One more, actually. So you're going to see a lot of text on some of these slides, but you will be getting these slides at the end, and I want to make sure that you can walk away and reference these well. So when we look at the whole process, we usually start with a problem arising. So for example, there was a study that came out in 2021 that found that formerly redlined communities were hotter than what were greenline communities today. This is a discriminatory old housing policy, but that problem arose. I thought that we needed to remedy that, and so I drafted a bill called the SHADE Act. And so we start with a problem arising, then Congress starts to debate it extensively. This is a long process. If you're familiar with Schoolhouse Rock, how a bill becomes a law, or I'm just a bill, the thing that they got right over and over again is that it is a long process. Sometimes bills can take many years going through many Congresses, going back from square one and starting all over again. But should things move through appropriately, law passes, then the agencies need to implement that. And what that looks like is agencies implement it. And then running all of this constantly is this need to get funding to sustain this work. So breaking that down a little bit further, lawmaking is what you think of when you think of Congress, writing those bills, whether it's the Inflation Reduction Act, Tax Cut and Jobs Act, the Clean Air Act. Those are the big program creations, the rules of the road, setting requirements, deadlines, etc. Great way to engage with the Hill is to work with members of Congress. Next up is the rulemaking process. Let's say a bill is pretty general, pretty vague. Maybe it leaves a lot of discretion to someone else to figure out what it means. So for example, with that shade equity tree bill that I referenced, we left it up to the discretion of the secretary to determine how to prioritize community, because there's only so much funding. So that's where the agencies start coming in. They need to interpret and apply the law, and they fill in the gaps via regulations, standards, guidance. So that might be your air pollution standards that we see, say, for example, through the Clean Air Act. That's your DOE appliance standards. And so the way to engage in that process is submitting comments and engaging with the agencies. Now, some bills in the lawmaking process don't require going through rulemaking. Sometimes they're self-executing. So, for example, there are some of the tax provisions in TCJA that once Congress passed a bill, they exist. Similarly, if we change the age on, say, Medicare eligibility, doesn't need any sort of agency interpretation. That is self-executing. It just exists. Post office namings, another great category. Finally, and like I said, appropriations, an annual process that's always occurring in the background. We're in the appropriations process right now as we rapidly head towards the funding deadline of September 30th for this fiscal year. And so it's important to know that, let's say you fought for a bill to pass Congress. Just because it passed, just because it exists in law, does not mean that it's getting dollars. So it's a fight that you need to continue engaging on. And so this is your DOE funding levels, your HHS funding levels, it's your disaster relief aid that maybe comes in a supplemental. And so the best way to engage is continuing to push for the funding or defend against cuts. We can jump to the next slide. Oh, actually, very quickly, go back one more, apologize. Very quickly, I have an asterisk at the bottom for lawmaking. For folks who are plugged into the DC world, you may have heard something about the overturning of the Chevron doctrine. This is going to be an interesting landscape going forward and how the lawmaking and rulemaking process interplay, because the Chevron doctrine essentially is forcing more weight onto legislative text drafting to make sure we clarify congressional intent, since we're shifting sort of interpretation onus from agencies now to the courts. So we haven't seen it play out too much yet. This is something that occurred in last year, but we expect that this will start putting more, will change the relationships between Congress, agencies, and the courts. Now we can go to the next slide. Again, a lot of text on this, but I hope that you can come back to this and figure out how you can engage in this space. So on the top line, this is a really broad brushstrokes of what happens when a bill is moving through, a bill becomes a law, and how it moves through the agencies. So it starts with a problem arising, and folks like yourselves are oftentimes part of that arising, that elevating that issue, that building coalition and bringing public attention to it and raising it with your local lawmakers, your state lawmakers, your members of Congress, so that folks start to investigate these issues. So the next step is that Congress will hold oversight hearings and, like I said, engage and dig further into this. And a place that your community can engage is submitting questions and talking points ahead of those hearings, whether they're bringing witnesses in, say either from the agencies or they're experts in the space, equipping members of Congress, particularly allies, with good questions to really dig into this further and to elevate this issue is really valuable. So let's say a member of Congress or committee really is becomes passionate about this issue and they draft up legislation. It goes through the committee process. It gets marked up, more hearings. Again, this is where, as a community, you all can act as a resource in drafting that and helping draft that legislation, providing data and experience and stories to shape the legislation in a way that will actually accomplish what it aims to accomplish. Once that bill is drafted, things like endorsing that bill and promoting it and circulating it to get other people to sign on to it is a great place for your community to engage. Assuming the bill advances through the first chamber, it'll have to go back around to the second chamber. There's that pathway can vary slightly, but for the most part, let's say it just has to start back over, kind of square one, drafting, markup, and passing a second chamber. But this is where you gotta keep it up. It's got to go through the whole thing twice. So let's say it becomes law. Now it's on to the agencies. This is where you may get things like requests for information or advance notice of proposed rulemaking. Those are optional. Those are not required to come out of the agencies. But that's a great time to now switch your gears. Go talk to agency staff, fill them in, Give them your stories, give them your data, give them your information, so that as they're crafting the rule and the guidance, they know what they know they have more, they're armed with more information. After that is the notice of proposed rulemaking process. It's 30 to 60 days. Seems to be shortening a little bit this time around, but that's where you get to submit comments and get your thoughts more formally over to the agencies. Finally, you get the final rule, and this is where advocacy continues to be required. It'll either get challenged, you'll need to either challenge it or defend it, depending on how the final rule comes up. There's always going to be attacks, there's always going to be people promoting it. So navigating that landscape is really important. And then finally, as I said, there's that funding piece of this. This is a constant. This process starts every year, about in February, but that gets delayed. But always you go back and start this all over again. I've focused heavily on the federal process, but a lot of this is similar to the state level. You still have lawmakers passing bills, you have the rulemaking process in the state agencies who are implementing that, and you still have the funding process where the governor and the legislatures are devising their budget and determining how to release federal dollars. A good way to think about this, as I'm sure no one is surprised, federal is that national framework, cross-state issues, major funding streams, while your states are more focused on the implementation, focused on local issues, and really tailoring the programs to community needs. A couple of places where for you all and your interests where states are playing a role, you have heat worker protections. We don't have one at the federal level. OSHA is working through that, but in some states, and I will say in some states because there's also messy state preemption laws in Texas and Florida, but some states are say passing heat worker protections. For example, Oregon, they require shade, breaks, and waters, but on water breaks. But you also see land management and local environmental policy done at the state level, permitting reform done at the state level, building codes, as well as insurance is regulated at the state level. But in terms of this process, it's very, very similar from the federal to the state level and how you want to engage along the way. We can go to the next slide. So now you very, very broad brushstrokes know sort of the process and the timeline, but let's say you've figured out what you want to go and talk to someone. You've got your issue, you want to talk to someone, and you want to advocate. So Congress and the federal agencies and the agencies can seem like a very foreign concept, really far away. I can tell you that even before I was working on the Hill, I would not have known how to get my foot in the door. I would not know what that would have looked like and where to even get started. So I want to talk to you a little bit about how you do this and how you maybe can do advocacy very simply. So to start, you want to meet with folks in Congress, let's say, and you're trying to decide who you should meet with. You've got a couple of options. Go to the folks if you're a constituent of theirs. So meet with your member of Congress, or if your community or you have advocates or folks in your group, get them to meet with their members of Congress. Great way to do that, finding your member, congress.gov, plug in your zip code. Next, you maybe want to talk to someone who has a personal interest. As I said, I worked for a New Jersey member on heat issues. So we'd have folks who are interested in the heat space going to talk to her, even though, in New Jersey, it wasn't a leader in the heat space in the same way, say, Arizona is, but still a place that we were quite passionate and excited about that. You can also look for folks based off of their caucuses, and I have a couple listed there: the Congressional Black Caucus, Hispanic Caucus, Asian Pacific American Caucus, Progressive Dem Coalition, and House Freedom Caucus, and see if your issue aligns with them. Finally, identifying some folks who are in a position of relevance. There's a couple of committees that are going to be particularly important in your space, say the Help Committee over in the Senate, Energy and Commerce in the House, Appropriations in both, and making sure that depending on what you want to talk about, you can find members through that pathway. Next slide. So when you reach out to these offices, I always like to warn people that there's a lot of people that are in those offices, and sometimes people expect that they want the member. Now, if you're going at the state and local level, their offices are way smaller and their timeline is slightly different. So you may be getting that state rep, state senator, their chief of staff. But oftentimes, when we start moving up to the federal level, you're going to get folks like the legislative assistants. And these are your policy experts. They meet with stakeholders, they draft legislation, they provide the vote recommendations. House offices are smaller than Senate. And so the Senate staff maybe cover 1 to 2 issues, say all health or energy environment. On the House side, where I lived, we get 6+ issue areas. I had energy, environment, natural resources, approach, foreign affairs, housing, dabbled in women's issues, dabbled in health. So making yourself a resource to these folks is really, really, really valuable because you can see that they're covering a lot of issues at once. You can go to the next slide. So so now you're trying to figure out what you want to meet with them and what you want to do or what your ask is. So a great way is just education, advocacy meetings, and letting them know that you're a resource and that you have data and information. So there's a couple ways you can do this. It's great to see so many folks on this call. You have obviously a very large coalition of folks. So this could be either Hill Days to show really large sizable interest in your issue, but they're kind of unwieldy and hard to do. So you just do one-off meetings. That's great if you're just trying to meet with your member of Congress, or maybe you've got an existing connection with someone, and you want to follow up with them. Also, a question for yourself is in person or virtual. I throw this calendar on the side over here to give you an idea of what the schedule looks like. Yellow days are where House and Senate are in session. Blue is just Senate, red is just House. But it goes to show you when staff are expected to be pretty much on the Hill versus off the Hill. If you choose to do a virtual call, which is now more common post-COVID, you can catch them, say, in August when their plates are a little quieter. They're not running around trying to do a dozen issues at the same time. And so you can maybe sit down and have a longer, more meaningful conversation. But an in-person is great if you're trying to make a splash, as I said, with Hill Days. Now, I keep talking about being a resource, but the resources that are really valuable to the Hill are, say, talking points and question lines. I mentioned those when we talked about committee markups and how valuable those are to make sure that members are amplifying your issue the way that you want it to be amplified, or digging in, taking the opportunity to say, dig in with the Department of Labor secretary and saying, where is the OSHA rulemaking on heat worker protection? So getting those resources to the Hill helps ensure that that issue stays relevant to them and stays on their radar. And then finally, I put requests as your appropriations funding requests. If there's programs that you want to see funded because your community benefits from them, or say you want to engage in the community project funding, which is earmarks, you'll want to get those funding requests in to those offices, to congressional offices, because they will then submit those to the appropriations committee. So crafting that and working with the offices to make sure your issues stay elevated, get the funding that they need, is really important in the appropriations process. We can go to the next slide. So as I mentioned, now there's a rhythm to Congress, and it's really important to keep an eye on that. Now, this is a little bit of an old calendar because obviously we are now well into September, but I show you this visual because it's important to see that there's a lot that is happening in Congress. And it's really important that when you reach out to staff, you are cognizant of all the other things that are maybe absorbing their time, because it's very, very easy to think that our issues are obviously the biggest issues to us, but they're one of many for folks who are on the Hill. So I show you this visual so you can see how many things, and these are just the regular sort of must pass or expected to pass sort of things. This ignores, say, right now in DC, there's the National Guard right now, there's conversations about Jeffrey Epstein, there's the gutting of the agencies, there's all the other things going on. So it's important to see if you can make your issue relevant to the conversations that are happening today. It's really hard. And so when I worked for an appropriating member, on the day that all my requests are due, and then someone would come and meet with me to do an introduction meeting just to tell them, hi, hello, here we are. And I'd be like, great, thank you. I'm so sorry. I need to finish this big request that we have. So making sure that you're thoughtful about what else is moving, and trying to make sure that your issue is relevant to the other pieces moving will help it stick, will help staffers remember it. They're more likely to look and go, great, I was looking for this information and I can use this right now. So just thinking about how your things fall into the other rhythms of Congress. We can go to the next slide. So let's look at so that was all Congress focus, and let's look at the agencies. So I threw up some here, some agencies here that are likely relevant to the heat space. But there's a when we look at the agencies, there's political appointees and career staff, which I'm sure most folks have heard a lot about. Political appointees obviously change the administration; they're agency heads, while career staff are folks that stay regardless of the administration. Now, I say all of this, but obviously, I'm sure folks that are following the news of the gutting of some of these agencies. So, this is all very, very, very up in the air and is very much impacting this whole federal process. But broadly speaking, the agency heads, the political appointees, they really set the priorities for the agencies to align with the administration and decide what moves, what rules should move, and what they should work on. And when you engage with them, it's important to do it early in the process where they're deciding what they should be moving on, as well as at major inflection points. So that's right before a rule is finalized. On the other hand, for the career staff, those are your rule writers. So they'll draft the actual rules and design the programs. They're great for meeting with during the rule drafting process and comment period, and come with data and evidence that they can use as they go through this process. Next slide. So now the what and the when of the regulatory timeline. So between last night when I sent this presentation over to this morning, OMB has released its unified agenda, and this is the regulatory forecast projecting what rules are coming and when. For your community, this is a really valuable tool to see what is coming up ahead and start engaging with and engaging and educating agency staff, as well as preparing your comments early. We'll get into this a bit later, but one of the things that we're noticing is that the windows of comment periods appear to be shrinking, and that's a really important time. So taking the time well ahead to get your comments and your coalition ready to go is really, really valuable. So keeping an eye on that unified agenda is really, really important. The next step in the process, and this doesn't always happen, is that RFI, the request for information, or the advanced notice of proposed rulemaking. This is where the agency maybe will float ideas, possible listening session, workshops, roundtables for stakeholder input. But this is just where they're taking information in. Again, another great opportunity to engage if they have that. Then it's a notice of proposed rulemaking, and this is where they open for comment periods. As I mentioned, it's a 30 to 60-day window about, and this is where you can really get your comments in. And it's important because the agencies need to have to review those comments. Otherwise, and this is for another topic for another day, is Administrative Procedures Law Act violation. But finally, the final rule comes out. Between the notice of proposed rulemaking, they look at all of those comments, maybe they revise and they publish. And this can take a really, really long time, can sometimes take months to years. So for example, I was just looking at the unified agenda before this, and I'm sure folks are watching that EPA endangerment finding repeal. And so they're trying to move on that fast. They expect to finalize that in later this month. They open that in July. So it's a really, really short timeline, where something like the OSHA rule doesn't really have a timeline on it. They just noticed the last sort of listening session, and that's all that they've published. So you can see how advocacy is really valuable sometimes to keep things moving, to make sure you keep attention and spotlight on this. And then after the final rule, this is where the Congress and the courts can still intervene. So for example, the Congressional Review Act in Congress is the mechanism by which they can pull back a rule, or they can block a rule, the courts can get involved, et cetera, et cetera. So it still takes a lot of advocacy and engagement to defend either the rules that you like, or say push back on the rules that you don't. We can go to the next slide. So overall, the why of the value of advocacy, this is really important because I think a lot of folks, especially in this day and age, can feel very run down and very tired and overwhelmed by all that's going on in this space. But it's so, so important to educate lawmakers at the state level, at the local level, at the federal level of your issues, because they do all listen to each other and they all talk to each other, to make sure that you build allies, champions, increase awareness, and then cement things for lasting change. And so I break this down into communication, policy, and rules. Communication is great because when you engage with these lawmakers, they can really shine a spotlight on your issue and bring it to a new stage or new arena that maybe you do not have the same access to. They have things like committee hearings and press conferences and just individual media engagement, where it's really valuable for them to continue to shine a spotlight on your issue so it doesn't get forgotten in all the things that we have going on in this day and age. Similarly, or Congress and legislative lawmakers at the end of the day also have to do policy and pass bills and laws. And so having someone be a champion and make sure that your issues don't get forgotten or attacked out of must pass vehicles, specifically things like appropriations or the Farm Bill or the National Defense Authorization Act, those are must pass vehicles that happen on a regular schedule. So ensuring that your issues are remembered by someone and get tucked in there or defended if they're attacked is really, really important. And then finally, the rules. Rules are how our laws are implemented and most felt by individuals. So, and as I said, a slide back or so, the agencies need to review your comments. So engaging the rulemaking process, engaging in comments is really important to ensure that um, you have an opportunity to shape what is felt by our communities. Next slide. One more. And then we'll wrap it up, I swear. And then we'll open up for questions. So I've thrown a lot at you about how to get in the door and where to engage and the process and all those inflection points. But now that you say in the room or got your foot in the door, and what do you do? Best thing is always to establish who you are and emphasize if you're from the district or your communities or the folks that you work with are from the district. Tie that to when you're talking to members of Congress and lawmakers, tie it to them, tie it to the people that they represent. It's also important to share stories and images to make your data more compelling and memorable. I think it's very easy, obviously, to say how bad wildfire smoke is, but if you can attach that to a story that staff and lawmakers can remember, that is going to help a lot in making sure that when they walk away and they go to that committee hearing and they say, I just heard of a story of someone who's impacted by the wildfire here. We need to protect these communities. It's going to last a lot longer. Also, use your meetings as an opportunity to develop long-lasting relationships with staff and become a trusted source of information. This one is so important. I cannot emphasize this enough, that you want those staff, that office to be calling you back up and saying, wait, you had something, you had data, you had a story. What was that? I need that for a talking point. I need that for a question line. Build a relationship by being a resource with that office, and it's going to be incredibly valuable both for you and your priorities and your interests and your issues, but also for that office when they're trying to say advocate for your concerns in the next appropriations bill, in the next big reconciliation package, and whatever that may be. Next is make your meeting a two-way dialogue. Don't lecture staff. I've been on the side of where advocates come in and they've got so much they want to tell me. It's lots of good information. But sometimes it's hard if you're just getting a lot of information. You go, great, thank you. I'll run it up the chain. Hardest thing to hear. Make it a two-way dialogue. Make it so, ask a question. What is your boss working on? What is filling their time right now? What is moving in Congress that we should keep an eye on? Make it so it's a two-way conversation, and get the staff involved in what you're thinking, so you're not just throwing a lot of good information at them. Engage them. And then finally, after your visit, obviously follow up with an email summarizing what you talked about. But more importantly, is hold them accountable or praise them. Like, continue to engage with them and make sure they see this. If they do something less than great on the climate public health space, call them out for it if you can. If they do something great, also praise them. They love praise. They also hate criticism. But just make sure you do it publicly and that they see it. But overall, I wanted to wrap up just by talking a little bit about sort of the climate and health landscape right now. I think the policy landscape. It's hard. It's hard. I think that everyone here is probably really familiar with the things that have been coming under attack under this administration, right? As I mentioned previously, there's the EPA endangerment finding, there's attacks on climate science, there's constantly pulling back funding from all these key agencies that are making it really hard to keep moving the ball forward on these issues, which just makes all the work that advocates do even more important to continue to uplift these stories, whether it's taking it from your community to your mayor to your state rep, state senator, get them to and getting them to then talk to their the congress members here in DC. Continuing to make noise is really important, and there are allies in this space. For example, there are folks who are trying to make noise in this space. For example, there's a Congressional Doctors Caucus here that's was launched by Rep. Raul Ruiz, which also has Reps. Ami Bera, Rep. Schreier, Conaway, Lauren Underwood, and they're looking at doing a press conference this week to elevate the risks of endangerment, the endangerment finding, focusing on healthcare professionals. So there is still a lot of folks who are making noise. It is just a very hard landscape right now. So that just puts even more opportunity for focus on advocates, an opportunity for states to play an important role in influencing Congress. And the closer that you get, I think, to the local communities, say mayors, your commissioner, your county commissioners, the sorts, they feel those impacts really intimately, right? They get you calling up when you've got a pothole in front of your house. They feel these things really intimately. So engaging with them is really important. Okay. Now Anthony, let's switch it over to questions. I threw a bunch at everyone, and I'm sure there's a couple of questions that I'm excited for.
Yeah, thank you so much, Carrion. This is a really great and meaningful. I just wanted to highlight, share some reflections on a few key points from your presentation, particularly the importance of advocacy at every stage in the policy process. You also emphasize the value of understanding how to get your foot in the door, knowing who, the what, the when, and the why, and clearly establishing who you are and where you're coming from. You also spoke about the role of storytelling and how meaningful engagement with staff and decision makers can serve as a springboard for long-term relationships, not just one-off interactions. These takeaways really offer not only practical guidance, but also inspiration that I think will be helpful for us as we move forward today. So we will move into the audience Q&A. Please, for the audience, please utilize the Zoom Q&A function for written questions. You're also able to use the chat function for your reflections. So I think we have one comment in the Q&A section. So the first question is, are recordings from the verbal comments and rulemaking available to watch? I have not been able to find any on the engagement finding.
They should be if they have listening sessions, but in terms of the written comments, the submitted comments, that you'll find online via the Federal Register. I just checked this morning. I think there's 83,000 comments that have been submitted on this. So just as a heads up, there's a lot, and something like that where there are a lot of comments does help slow down the process. But when they have listening sessions, they should be recorded. It just depends on if they had listening sessions.
Great, thanks, Gary. Any others? That's the only one that I saw in the QA. Any other comments from folks in the audience? I see Lily's hand.
Yeah, thank you. Thank you so much for going over all this. It's such a good refresher, I think, for some of us, and just setting a foundation for all of us. I'm curious to know if you have any thoughts on the use of AI tools for advocacy. I just recently heard of a tool, and I think I'm going to get a free demo shortly, where they are using AI to kind of look at all the comments made publicly by certain elected officials at the city level. And it's just city level so far. It's like city council meetings. But then they're using that information to kind of generate a profile of these electeds, which seems like could be a really powerful tool. And according to the person who made it, it's already being used by real estate developers. So anyway, I'm curious to know if you've encountered anything like that, or what your thoughts are on that as something that's probably coming for us all.
I have not used AI extensively in I think the advocacy space. I think there is opportunity to probably use it for this research space, especially in the compiling of all this information from electeds. I do think there is still, however, value of building that relationship with, say, the members themselves and their staff. There are a lot of things that say they maybe say publicly that they maybe don't, that isn't what they say privately. That is always important to have those relationships to better understand the nuances of some of these things. I will say that in my work, where I specialize in sort of analyzing this whole landscape this whole federal and state landscape on energy and policy, and then synthesizing and explaining it to someone, that AI does still like to hallucinate a little bit and make a couple things up here and there. So I do still think that sometimes having these conversations with staff and with the members to help clarify their thinking and what their priorities are and what they're doing is still really important. So there's, I think, probably I'm the wrong person to ask on this, but I think I'm sure there's opportunity for the AI to help do research and organize this, but there's also still an important piece to engaging directly with offices and members and their staff.
Thank you, Karen. One note, Zitlali, the speaker, I mean the participant who um, asked the first question, was away when you answered her the question. Do you mind just briefly answering the question about the recordings from verbal comments and rulemaking, and if they're available to watch?
Oh, yes. Yeah, yeah, sure. If there were listening sessions, and I'm not 100% sure, but if there were listening sessions, they should have been recorded. However, for the comments, those are submitted via the Federal Register, and you can go back and read it. You can go read and review those, but there are about like 83,000 comments, I believe, in already. So as a heads up, it'll be a hefty September read. But yes, if there's listening sessions, those should be available for recording.
Great. And we have one more question. So how can we enhance the research in this field?
To the person who asked that question, do you want to clarify do you mean enhance research as in making it more available to staff, or what field are you referencing?
And Dr. Al-Shab, you're free to come off of mute if you would like to ask as well.
Well, I can take a swing at it, and hopefully this answers it. I think there's a couple of the way that I read this is, how can we make sure that research is, say, getting to lawmakers in the Hill? And that's through folks like you all, making sure it lands on someone's desk. I told the story at the start where I came across a study about formerly redlined communities and extreme heat and shade equity. And that was purely because I happened to stumble upon it because I like to read things like that. But no one had brought that to me. And if I hadn't seen that, haven't found it, then we wouldn't have drafted legislation specifically about tree planting in formerly redlined communities. So getting your research out to staff, coming armed with it and filling them in on these interesting things, talking to staff that say have that interest, how you can bolster their work as well, is, I think, really important. And that's where I think it's important on folks who have that research to tell their story. So when I reached out to the researcher saying, "Hey, I found your research and I really love it. I wrote a bill," he was ecstatic. He was thrilled. He never thought about like that as a possibility. But I think it sounds silly to say how much legislation isn't written with research in mind. So when you have the opportunity to really elevate it, take that, run with it, and make sure staff see it, so that if you identify an issue within your research, take it to someone, get it to someone, so that they maybe can possibly explore a legislative opportunity to remedy something.
Great, thanks, Karen. We have another one from Josh Glasser in the chat. Says, I'm curious your thoughts on engaging the media, national or local, as a way of reaching policymakers. It seems there can be heavy and impactful media coverage, but only during acute events and not year round.
Yes, definitely engage the media if you can, and make sure that when you get those stories, get them to lawmakers. There's a couple of ways you can think about this. One, you can either try to get things into the DC orbit, and that's your Politico, that's Axios, that's Punchbowl, that's The Hill, Roll Call, all these DC, say Congress, lawmaker centric. I will say that also in the state legislatures, they have very similar sort of um, lawmaker focused news outlets. And that's great for really insider baseball. So, for example, like right now, there's a lot of conversations about pocket rescissions and the negotiations that are happening on that. Doesn't really impact everyone, but that's something that is absorbing, say, the minds of Hill staff. So that's one route of engaging with media. You can also make noise in your local community, right? It's continuing the drumbeat within your own communities does is really important because if you are one person and you're calling up your senator and you're like, hey, there's this issue, they're going to go and Google the issue that you're talking about. And if it's crickets out there, they're going to be like, okay, so this is one person with one concern. But if you get folks talking about it, if it's something that is coming up in the local newspapers over and over again, and they see that it's a continuing issue, they're more likely to say, ooh, this is something that is on the minds of our constituents. And so it's all really using the media as a tool to grow interest on a topic and get people talking about it is really, really important. Obviously, as sort of as you're saying, it is hard when there's a season to things. Using heat as an example, come November, I'm sure we'll all like the news will have moved on. But that is where folks like these communities or your advocacy community is really important to keep a drumbeat on that issue that when we hit December, when everyone is looking at LIHEAP funding for supporting folks during the winter, making sure that funding is still dedicated to summer cooling expenses for the LIHEAP program, and that it is important that we also look ahead that summer is around the corner, and we cannot keep forgetting that this happens every year. And so it's having that, it's important to have a steady drumbeat of an anchoring your and looking ahead and planning for that. But using media as a tool is really valuable. Sorry, that's a very long answer.
No, that was great. Thank you, Karian. Another one, the question is, thank you for your presentation, Karian. I can definitely see parallels with the process of advocacy and interacting with members of parliament at the provincial and federal level in Canada. I'm curious if you have any suggestions for resources for further guidance and advice for those of us north of the border.
Great question. I don't off the top of my head, but would be happy to follow up with you and chat a little bit more. But no, I do not. I don't off the top of my head.
Okay, great. And um, other question from our very own Fumi. What's the first step someone should take for local policy change who is completely new to this space?
I would recommend if you're looking at local policy, I would definitely recommend reaching out to your local elected, say someone like your mayor or someone closer to you, or just going straight to say your state rep. Or state senator and elevating this issue. It sounds really scary to reach out to these folks, but I can tell you from the congressional level, I got calls from constituents all the time. Like that's exactly what folks do. You call them, they answer it, they listen to what you're going to say, they record it. We do record it. We take that in, whether it's written or a phone call, and we look into that. Right, that's exactly what we have to do. Similarly, if you want to have a meeting, if you've got say your organization, it's I will say for meetings, it's better to go as an organization that you're representing. Schedule a meeting, reach out, say, hey, I would like to talk to your health staff, or I'd like to schedule on behalf of my organization, Pioneer Public Affairs, I'd like to schedule a meeting with your energy staffer to discuss grid reliability. And you can do that. That is very much available, and it sounds really far and foreign and distant, but calling them up, submitting comments on whatever is going on, they're representatives and that's what they're supposed to do.
Great. We had just one more. I know we're coming up on time in a minute, but we'll take this last one. Given the rapid growth of AI and research, how is the Appropriations Committee approaching funding and oversight to ensure AI tools are developed and used ethically, especially in areas like data privacy, bias mitigation, and academic integrity?
It's a great question, and I don't have a great answer for that because I'm not following closely the AI, development of AI tools. I focus if in the AI space and the data center space, I'm focusing more heavily on the energy element. But I'd be more than happy to follow up with you and discuss that further.
Great. All right, that was wonderful. Thank you so much, Karen, and thank you everyone for your questions and insights and reflections. We'll now begin a 15-minute break, and we'll return at 1 p.m. for the main event.
Thanks, folks.
Welcome, everyone. It's a pleasure to be here with you all today. My name is Shania Taylor, and I am the Acting Director of Programs at the National Academy of Medicine. Thank you for joining our Climate Communities Network first public event, leveraging data to drive effective heat protection policies. We are gathered today because extreme heat is not a distant possibility. It is our present reality. Across the United States, extreme heat is already impacting the health and well-being of communities, with the greatest burdens falling on those most vulnerable. Yet we also know that data-informed heat policies, especially when designed with and for communities, can protect people from harmful exposure and prevent devastating health outcomes. That is why this conversation is so important. Data-informed policy, co-created with and governed by communities, has the power to reduce heat-related deaths and protect health on a massive scale. But it requires us to think differently, to break down silos between public health, climate, labor, healthcare, and community systems, to share data transparently, and to ensure that the people most impacted have a central role in shaping, implementing, and improving existing heat policy at the local and state levels, as well as private policies within organizations and health systems. The National Academy of Medicine is uniquely positioned to bring these diverse voices together. Our role is not just to convene, but to create space where scientific expertise and lived experience are treated as vital forms of knowledge. Through the Climate Communities Network, for example, we've seen how grassroots leaders, national partners, and health systems can co-design solutions that are both locally grounded and nationally scalable. That same spirit of collaboration is what today's event represents. So today you'll hear from experts working at the intersection of heat, health, and public and private policy regarding how they're working alongside communities to co-build data-informed frameworks that protect community health. So on behalf of the National Academy of Medicine, we're honored to be hosting this timely event to bring together diverse partners and actors to shed light on the importance of engaging communities to address the increasingly urgent threat of extreme heat and its impacts on community health. We have an exciting event planned for you today that will include insightful speaker presentations and multiple opportunities for audience speaker engagement. So thank you all again for joining us. And with that, I'll turn it over to our wonderful MC, Anthony Nickum, to introduce our first speaker. Over to you, Anthony.
Thank you, Shania, so much for your powerful and opening remarks. And hello, everyone. My name is Anthony Nickum. I am a CCN Strategic Partner and Environmental Justice Fellow at the WMC, as well as a co-lead of the group that planned this meeting. I'm really excited to be here with you all today as your MC. Before we begin, I want to take a moment to acknowledge the collective effort and shared passion that brought this event to life. This meeting, driven by the outstanding leadership of the NAMCCN, its members, and strategic partners, reflects not only the months of careful planning, but also a deep commitment to working with communities and organizations to addressing climate challenges and uplift the role of data in shaping effective heat protection policies. Please note this meeting is recorded, and we will share the recording and slides on the NAM event page in the coming days. I'll now turn things over to John Balbus, Principal at Climate Care Consulting, for his opening remarks. Dr. Balbus, over to you.
Great. Thanks so much, Anthony, and good afternoon or good morning to everyone. Many thanks to you, Anthony, and Shania, Emma, the entire NAM Climate Communities Network team for inviting me to speak with you today. Before I begin, I just want to take a moment to acknowledge that we are in historically challenging times for public health. The firings and maltreatment of thousands of federal employees, the clawing back of funds and cutting of federal programs, and the literal attacks on public health officials around the country are all painful and traumatic. And we are all allowed to feel this. I just want to start by acknowledging these feelings that we can feel sad, scared, frustrated, and angry. But that's also why we're all here today. This is just one more piece of the response to all of this. One more way that the public health and the health equity communities are continuing to find ways to protect people, to do the work we know is so important, and to channel our difficult feelings into positive actions. Could I have the next slide, please? So here's what I hope to cover in the very short time we have together: what we know about heat and health, how we know it, what we've done with that knowledge, and what we still need to do. Next slide, please. Turns out we know quite a bit about heat and health. We know that our bodies are pretty good at dissipating extra heat, but up to a point. We get rid of heat by opening up blood vessels and letting more blood flow closer to our skin, and we also cool our skin by evaporating sweat. So a few things happen as we try to cool our bodies. First, more blood flow to the skin depends on us being adequately hydrated, and it makes our hearts work harder. It also means less blood flow to other organs, including our brains, kidneys, and intestines. For people with weaker hearts or existing diseases, just this effort to compensate for high heat can lead to illness and even death from heart failure and heart attacks and kidney damage and other kinds of organ damage. Other people at risk may be taking medications that either interfere with their body's ability to open and close blood vessels, or that cause dehydration, or otherwise interfere with the body's cooling mechanisms. People who are taking those kinds of medicines will be among the first to experience rising internal body temperatures. And as the body temperature rises, our blood clots more easily, our bodies have more inflammation, and sensitive organs like the brain, kidneys, heart, liver, etc., can all be damaged. Next slide, please. So all of this means that heat affects our health in a whole bunch of different ways. If our bodies heat up too much, we can get heat exhaustion and stroke. But if we have existing damage to our cardiovascular system, to our lungs, to our kidneys, or other diseases, all of that stress and inflammation that I mentioned before that comes with excess heat in the body can tip us over a balance and cause exacerbation of our diseases, can make us sick, or even cause death from failure of those organs. And so we know that heat stroke is only part of the picture of heat-related deaths. There are many more deaths that come from heart and lung failure, kidney failure, and other causes. Heat also affects pregnant women and their unborn children, causing premature and underweight births. We know that heat causes many other stresses in addition to the physical stresses as well. The sensitivity of the brain shows up in things like impaired learning in children, impaired thinking, impaired sleeping. We see more violence and worsening of mental health during heat waves. For individuals and communities already experiencing high levels of stress at the intersection of poverty, persecution, and other forms of social injustice, this added physical and mental stress from excess heat can be devastating. And we know that in addition to illnesses and medications making people more likely to get sick from heat, the conditions in which people live, work, and play, and go to school have a huge impact on their exposures to heat. Most of us on this webinar are relatively privileged, and we have cool places we can go to where we can work and sleep if it gets very hot. People who are unhoused are at greatest risk, especially as nighttime minimum temperatures keep increasing. But millions of people who have housing don't have enough money to either have any or at least working air conditioning or to pay the utility bills to run their air conditioning. Others, in addition, or instead of lacking cool spaces to live and sleep, are exposed to excessive heat when they work, because they work outdoors or in very hot factories or other hot indoor environments, thereby adding the heat of their physical activity to excessive outdoor or indoor heat. Having cool indoor spaces is critical, but we also know that the landscapes we live in can contribute to health problems from heat. In particular, urban spaces without tree cover and reflective surfaces can trap heat and expose the residents to temperatures many degrees higher than surrounding areas. And just like access to air conditioning, these urban heat islands occur predominantly in low-income communities of color. Next slide, please. And this is just a series of maps that provides an example of how urban density, paved surfaces, and lack of tree cover are all associated with historical redlining practices that discriminated against mostly Black communities in Richmond, Virginia. This is an example from Richmond, Virginia, but this mapping and scientific studies showing the continued problems with heat and other illnesses and other exposures associated with being placed in what was called a high risk or redlined neighborhood, which tended to go along racial lines in the 20s and 30s, continues to cause heat problems these days. So if we go to the next slide, this shows the association between redlining and a lack of tree cover. So the redlined neighborhoods are outlined there, and you can see they don't have as much green. And next slide just shows how this translates into temperatures. So those redline neighborhoods tend to have higher temperatures than the areas that were green or yellow lined and had more tree cover. And we'll just stay there for now. How do we know all of these health impacts? How do we know about this association with redlining? Well, it's from the collection of robust, accurate health and sociodemographic and environmental data, including weather measurements. Our data are far from perfect. Most studies historically have relied on death certificate data, which can identify most cases of heat stroke and captures some individual characteristics, but which misses most of the cases where heat makes underlying heart, lung, or other diseases worse and causes death. More recent studies have looked at counts of all deaths and used statistics to estimate excessive rates of death associated with temperature extremes from things like cardiovascular causes, respiratory causes, diabetes, etc. And this is why we can say that death certificates undercount the true deaths associated with heat, but this method doesn't allow us to identify specific people who died from the heat and understand why in individual cases. And without a functioning CDC, access to data on heat and health will be piecemeal and even more incomplete. Next slide, please. We also know this because the federal government, NGOs, and community-based organizations have, together or separately, done a lot of heat mapping to show differences in heat exposures block by block in cities. Sadly, for the funding for the NOAA Center that was supporting this work has been cut, so there is a need for private support for this work to continue. We also have satellites that can show surface temperatures to a high degree of accuracy. And increasingly, in addition to this quantitative data, we're collecting stories and other qualitative data to fill in the human nuances of behaviors, perceptions, and exposures. And as this picture shows, it's the collection of quantitative data by urban heat mapping brings people together. It brings oftentimes students or other kinds of citizens in to better understand the situation in their neighborhoods with heat. So it's both a quantitative exercise, but also a social and qualitative exercise. So what do we do with our knowledge? How do these data help us save lives and protect people? It comes down to two things, I'm going to say. Timely phrases and cool spaces. Next slide, please. Historically, we've focused on the former. I'm using timely phrases to indicate things like early warning systems and heat advisories. Recently, we've developed more sophisticated indices like heat risk and the Cal Heat Score that we'll hear about. Their innovative inclusion of actual heat data, actual health data, help them provide more accurate levels of risk for a specific location and make those early warning systems and advisories more focused and more precise. The key challenges here are getting the message to the people who need it the most, who often aren't on cell phones or aren't listening to radio or getting the messages through the normal channels, and then getting them to take action. Cool spaces, that means cool spaces to live, sleep, play, work, worship. With changing climates, areas of the country that got by without air conditioning for decades now see tragic death tolls from unprecedented heat events. And with heat seasons stretching longer and becoming more intense, we can't just rely on warnings for the most extreme heat days. The solutions will have to be cool spaces for all. But how do we do that? Policies have to promote energy security first, clean energy so we don't continue to exacerbate climate change, adaptive building design and codes, indoor heat standards for schools, rental apartments, and especially occupational standards to protect vulnerable workers. A year ago, our country was on a path towards all of these solutions. Not perfectly, not without gaps and challenges, but making progress. and sadly, that path has been ravaged. For effective early warning systems, we need a federal government that supports state and local health departments, makes investments in needed research, especially research that engages and increases our ability to help the most at-risk individuals, and that continues to collect the data and do the science to develop better and better risk tools. Local city, county governments need to bear the brunt of developing and implementing multi-sectoral health plans, engaging emergency management, public health, local healthcare systems, and other government agencies. States provide financial and technical support and emergency backup in the setting of bad heat waves. And states and the federal government also need to provide finance and policy incentives for the longer-term energy and built environment solutions that I was mentioning. In the near term, it's unlikely we'll see the federal government adequately meeting the needs I've laid out. And so we'll be discussing today the ways that state, local, tribal, and territorial governments are doing their best to step up and how the private sector is also stepping up and supporting heat protection. In every setback, there are lessons and there are opportunities as well for innovation and advances. In losing the federal support, I hope, and I'm seeing evidence, we are unleashing an incubator of heat protection innovation as the various states and localities and companies all endeavor to create or expand evidence-based solutions that work for them in their place, in their context. Today's webinar will give great insights into how this is happening from leaders around the country. So with that, let's get on with the webinar. Thank you for your attention, and I look forward to learning from our speakers and panelists today with all of you. Back to you, Anthony.
Thank you so much, John, for your excellent presentation. You not only highlighted the health impacts of heat, but also grounded us in the realities of this moment and reminded us of the steps we must take to ensure the meaningful work to address heat and health issues continues. So thanks again for your commitment and dedication to this work for many, many years and sharing your time with us here today. So before we begin the panel sessions, I want to review the ways the audience can contribute and engage throughout the event. For written questions, we encourage you to use the Zoom Q&A function. And then also for reflections, please feel free to use the chat. I'll now turn, I want to add as well that both the chat and the Q&A will also be monitored by NAM staff as well. So we'll have folks on the back end supporting. So I'll now turn to the Climate Communities Network member and co-lead of the group that planned this convening, my colleague and amazing person, Lucretia Berry Daniels, who will be leading our panel discussion one. Take it away, Lucretia.
Thank you, Anthony. Thank you so much. So my name is Lucretia Berry Daniels. I'm a public health social worker and a public health professor at Wayne State University in Detroit. I'm honored to be facilitating this panel. What we are really going to focus on for this panel is how state and local policy, how public policy at the state and local levels will enable us to protect community health. So this topic is so important. Effective public policy at the state and local level serves as a critical tool to protect community health, especially for populations who are disproportionately affected by environmental stressors. There's a great need for equity-centered approaches in shaping responses to climate stressors. And we are joined by three panelists that will talk about exemplar ways that this is happening in communities. So I would like to first just introduce the panelists that are joining us. Walker Wieland, Chief Extreme Heat Ranking System Development Section, Office of Environmental Health Hazard Assessment at the California EPA. Carrie Olson, Assistant Commissioner, New York City Department of Health and Mental Hygiene, and Cheryl Holder, the co-chair of Miami Climate and Heat Health Task Force. Each panelist will provide their remarks, and then we will wrap up the session with a moderated Q&A. So Walker, we'll start with you.
All right. Thank you very much, Lucretia, and hello, everybody. It's good to be with you. I'm going to go ahead and share my screen. All right. So, as Lucretia mentioned, my name's Walker. I work at the California EPA, and I'm a scientist there, and I manage a team of scientists that are developing and maintaining a extreme heat ranking system for the state of California called Cal Heat Score. So I thought with my short time, I just get right into the nuts and bolts of what it is. The best way to think of what Cal Heat Score is, it's a ranking system really similar to existing hurricane indices or tropical storm ranking systems, right? The higher the number that Cal Heat Score produces for your community, the more severe the temperature, the more severe the health effects on the community. That's the best way to think about what Cal Heat Score is. Cal Heat Score provides a daily heat ranking for every zip code in California. Every one of the 1,800 zip codes updated every 24 hours, but also provides a forecast for the week ahead so that you and your loved ones can get a sense of what extreme heat conditions are for today in your community, as well as the coming 7 days. Cal Heat Score factors in climate data, weather forecast data that's hyper-localized to take into account all of the different, climate conditions throughout California. But also really the key driving point, which John mentioned actually in his opening comments. The key driving factor that makes Cal Heat Score unique and powerful is that it factors in public health data. It incorporates emergency room visitation rates for patients that have suffered from extreme heat, that are suffering from extreme heat morbidity, right? So some of the acute extreme heat cases that we see, such as heat illness, heat exhaustion, kidney failure, right? So that's folded into these Cal Heat Score rankings so that when you see a particular ranking level for your community, it's based off of past observations. So we're literally conveying the risk of community heat-related illness based on past data that we've seen in your community. Cal Heat Score is also meant to be a tool to provide broad educational messaging about heat. What we're trying to do with Cal Heat Score is give people the resources that they need to understand how severe extreme heat can be and what the implications are for your health, but also what's locally available to you. Where's the nearest cooling center? Where's county-specific information that you can use once you understand that risk? So I'm just going to give a super fast demo of what Cal Heat Score is. You should be able to see it on your screen. I'm hoping. Can I get a thumbs up if the tool is showing up? Yes, maybe no. Oh, awesome. Thank you, Carrie. Appreciate that. Yeah, so Cal Heat Score is available now. We're in our first year of Cal Heat Score. It was released at the beginning of this year, and you can access it right now to look at heat risks in different communities throughout the state. This screenshot here shows an area just north of Los Angeles called Burbank, and there's some significant heat in Southern California today. So when you click on an individual zip code, you can see that this very much is set up like a dashboard, and it shows you information about what the ranking is, information about temperature, the record high. Clicking across the bottom shows information about age, race and ethnicity, as well as different indicators of who has health insurance in this community, who's an outdoor worker in this community, and how many people may not speak English as their first language. The last thing I'll show on Cal Heat Score tool is that you can click on this tab called Cool Centers, and we're pulling in live data from the County of LA into Cal Heat Score so that people can understand not only what are the sort of different heat levels and heat risks, but also clicking on one of these triangles shows information about the nearest cool center and has information like the operating hours. So I'm going to pop back over here to my presentation. Great. So we think that there are a wide variety of different users of Cal Heat Score, not only individuals to make decisions about their day, such as when to go gardening or when to exercise outdoors, but also for local government use, such as when to deploy resources, open cooling centers, and send out care teams to check on older individuals or other folks that might be more susceptible to the effects of extreme heat. There are a number of other organizations on the screen, and really we think there's a wide range of different users for the tool based on different sorts of use cases. And I'm going to talk a little bit about how we're growing that work in this first summer of Cal Heat Score. So we've got a contract with a few community-based organizations in California to help us co-design our engagement and process and use case process around Cal Heat Score. So these 3 tasks are laid out in this work, right? So we're working with these CBOs to help us figure out who should we be talking to? In what format should we be having these conversations on Cal Heat Score? Who are the key players in Oakland versus Redding versus San Diego versus Imperial? This is all so important. They're helping us design our training materials for Cal Heat Score, such as how the user guide should look, how the training videos should work, and they're also providing us input on how Cal Heat Score should be used in different local and state and community use cases. Just a quick note here on how Cal Heat Score slots in with California's other heat efforts. I know I only have about a minute or two, so I'm going to move quickly through this. The state of California has a grant program for extreme heat resilience that involves investment in both infrastructure projects for cooling centers, other nature-based solutions, and also in the planning space. And so our colleagues at the Department of Land Use, Climate, and Innovation are using Cal Heat Score to get input on how funds can be dispersed throughout the state for different types of projects. And also Cal Heat Score is a prominent part of California's broader extreme heat action plan, which shows the sort of all-of-government approach on how California addresses extreme heat. Quick map on some of the money that was dispersed this year to different parts of California. We're also working to develop training materials with some of our partners at UCLA to build out trainings for how Cal Heat Score can be used in different use cases and how educational materials can be built around Cal Heat Score. Another sort of engagement process we're working through is we've built out cohorts to help us understand how Cal Heat Score can be improved at a local level, and also get a sense of how the tool can be used and how people can keep coming back to it, and it doesn't just end up being another tool that sits on the shelf. So these are 3 examples of our cohorts: tribes, outdoor and warehouse workers, and older adults. So next steps, we were really this year, we're raising awareness. Cal Heat Score exists, give it a shot, try to use it and see how it works for you. We're working through our co-design process this year and next, always planning iterative updates to our tool. This is a process that is ongoing, and Cal Heat Score will be around. And so the information that we're getting from communities and the ways that we're listening and getting input on how the tool can be improved informs the development or the next versions of the tool. We have lots of future ideas for Cal Heat Score. I'm going to skip them for now because I know we're short on time, but we are really getting great input on different ways that the tool can be improved and can be expanded across the state. And if this is interesting to you, I'll also put it in the chat, but we've got our website here and our program email, and please give the tool a shot if you'd like to. So with that said, I'll kick it back over to you, Lucretia, and I will stop sharing.
Thank you so much, Walker. And there's a lot of energy around this. There are lots of questions coming in the chat and a lot of reflections coming in the chat. We will hold off on those for now. But thank you so much for sharing that. And what we're going to do is continue with our panelists. And so we will move next to Carrie to hear from you. Thank you so much.
Great. Thank you. And I'm going to try to share my screen as well here. So just give me 1 second. Can you all see my screen? Can I get it? Okay, I saw it. Okay. All right, great. and I'm an assistant commissioner for environmental surveillance and policy at the New York City Department of Health and Mental Hygiene. And I really want to thank the Climate Communities Network and the other panelists and everybody who made this happen. This is such an important topic. And I know here in New York City, we're thinking a lot about how response to climate and extreme heat is important, not just for our city, but really for the communities that make it up. Community resilience is truly key to withstanding climate threats and recovering from them. So here at the health department, we've been doing climate work for more than 15 years now, and we've really grounded that work since its inception in data. Starting first with that quantitative environmental epidemiology to really outline and understand heat and other climate threat health risks, and which populations and communities are most vulnerable to that burden. But today, what I'm going to focus on are our efforts to empower communities with the data that is most meaningful to their work to address climate burdens, and also how we're working to bring community voices into our work. So I'm going to highlight 3 pathways in my brief time with you. One is Your Heat Story, which is an online tool that I'm going to show you. I'm going to talk about our Heat Vulnerability Index for New York City, which is not dissimilar to what we just saw for California, and how that works to understand community level risk. And then our Climate Resiliency Advisory Network and how we have integrated it into our work. So I hope I'm going to pique your interest, and I'm very happy to discuss more and answer questions, of course, as we go through. So everybody should see right now our environment and health data portal, which is a keystone data communication tool that we use at the health department that has over 250 different environment and health indicators that anybody can explore. There's different stories and information and interpretations. But what I'm going to navigate to and show you right now is a new tool in our Climate Hub, which is Your Health Story. This is a very special collaboration. It was built through a very special collaboration that is between academic, government, and community organizations. It was started initially by Columbia University in collaboration with a community-based organization called South Bronx Unite. And they embarked on a community research project in the South Bronx and Northern Manhattan. So for those not familiar with the city, we're talking about the South Bronx here. And can you all see my little hand? I don't know. Hopefully you can. And Northern Manhattan. And they work together to combine and collect both quantitative data on hyper-local temperature and other information with qualitative data that reflected what residents are experiencing. And we had the opportunity to partner with them to really expand this work into a stable but also dynamic tool that would both update in real time the variety of different data, as well as cover the entire city, all 5 boroughs, which is all of this, and really create something that could be used across communities. So what this tool does is it allows individuals to view firsthand narratives alongside heat health burden statistics. So I'm showing you an example here. I'm not going to read the story, but I encourage you to go on. I'll put in the chat all of the links and everything at the end. And you can see that the story comes up. Some of them are anonymous, some of them are attributed. And then there is a pin on the map, and it zooms into the community where that story is from. And that pin is overlaid on data. And the data is controlled by the user. There's one data arts, and then at the bottom, people can choose, as you can see, different things that they might want to look at. And this particular story shows data from our heat vulnerability index. And so I'm going to take an opportunity now to tell you a little bit more about this measure of community level risk that we have that is related to and built upon risk of heat morbidity and mortality. We have another tool that people can also explore that makes it easy for community members and community organizations to interact with this and see information on the heat for their neighborhood. And so this index is built on 5 different indicators, both environmental and social, that describe the burden of heat mortality in that neighborhood. And the most important of those, as has already been discussed by Dr. Balbus and others, is access to residential cooling in New York City, which is one of the 5 indicators. And access to air conditioning is not just about having the equipment, but as already discussed, it's also about having access to affordable energy. And so one of the things that we're doing right now to expand your New York City heat story is we are funded by the Partnership for Healthy Cities to do a qualitative project to collect firsthand stories from residents in New York City about their experiences of energy insecurity or the inability to meet household energy needs during extreme heat. And so that leads me to the last thing that I'd like to share with you all, which is how we're continuing to collect and expand the stories that we're providing on Your Heat Story. One way is that anyone can submit a story, as you can see down here at the bottom. But really, we worked with an incredible group of community organizations to further add to these stories. And that was through our Climate Resiliency Advisory Network. The organizations, there's 10 organizations, all different types of folks, and all different types of organizations that we are fortunate enough to partner with. And we designed this group. It's been active for 2 years now to intentionally incorporate diverse community input into all of our climate-related research, policies, and programs. And just one of the ways that they've done that is that they worked to collect stories from the residents that they are working with every day on the variety of issues that they do, and have added those to Your Heat Story. So some of these are from their efforts and their continued efforts. And those organizations range from environmental policy organizations to mutual aid organizations doing a wide variety of work. And all of them have committed to working with us to really bring community voices and work into what we do every day at the health department. We did this very intentionally, and we provide compensation for their expertise and their time for working with us on this and being a part of our CRAN, or Community Resiliency Advisory Network. And I know that I'm probably over time, so I want to thank everybody so much for this opportunity to share these things, and I'm happy to answer more questions that may come up, and I will stop sharing.
Thank you so much, Carrie. Similar to as Walker was talking, we were getting lots of questions coming in, and so lots of energy around this topic. So thank you for what you shared, and we will be asking those questions a little later. But now we're just going to turn it over to Cheryl. And then again, after we hear from Cheryl, we will have time to field some of the questions that have been coming in. To you, Cheryl. Thank you so much.
Hi, good afternoon, everyone. Thank you for inviting me to speak today and sharing my community story. I too will be sharing slides. And I think I've been on many of these presentations over the years, and I tell everyone my motivating factor, my patients in the community. And there's one thing they always tell me when I say, so how you doing? Good seeing you. And they go, I'm blessed, highly favored. And that's what I feel when I share this community story of what we've done in Miami-Dade County. And this goes back 2016 when the Resilient 305 got started and getting the word out about same sunny day flooding and all the problems that have been happening. And by 2018, a collaboration of universities, counties, cities, nonprofit organizations, the human services organizations, the foundations started coming together in tackling the problem that after listening sessions, and we did one, our organization, FCCA, with clinicians, and many group within the community said, heat, heat, heat is the problem. And with that, we used the general thing that you've seen before about the heat vulnerability index. And this came out of University of Miami, mapping our community and finding where are the hot spots. Where are we seeing the high heat areas? And you heard about urban heat island. And in addition to the high heat, where the socioeconomic challenges are, the low wealth, low education, low tree cover, and more data was collected with the assistance of the county and all the universities, where they're able to track the heat, the income level compared to where the tree covers. And of course, we know the data, you've seen it before, low wealth communities have less tree cover. And South Florida, Miami, being a Jim Crow developed city, already told you where low wealth people would be because this was defined by Jim Crow, where people who were formerly enslaved had to live. And then that continued to build upon the low wealth issues and where Latin people and other lower wealth communities exist. And of course, their heat. And the high heat urban effect is very much throughout a lot of the cities. But what is again important is in South Florida is that the high heat may not affect you if you do have access to cooling. And where some of the hottest areas are downtown area by Brickell, super hot, but very little health impacts because of wealth. And then the data was collected even more about what really is more important is the actual temperature or the feel like temperature in a community that has a lot of humidity. And where did we see the health harms? And that then led us to do a data analysis. And this was led by the university and the county pushing to find out how does heat harm our communities. And this showed that the death rates was more than just heat waves like what you would see in the Northeast and other places, but a continuous throughout the year. But of course, with the heat season and identifying the areas that were most significant, which is from May to October, and defining a heat season. They also determined the amount of hospitalization emergency use cost, and that led to us coming together again. And by 2023 or so, we were able to get the community to push the universities, the funders, the political will to create a chief heat officer. And Miami got the first heat officer in the entire world, who is Jane Gilbert, and then followed by the rest of the world that followed the work that we've been doing in Miami. That political will and the data pushed us to work with the National Oceanic Atmospheric Administration, NOAA, to identify with the National Weather Service, when do we need to put out the warning? Previously, they waited till high temperatures, 110 degrees, feel like temperatures before the warnings. But our data showing that the deaths and the harms are happening lower. So that changed our heat threshold from the super high at 110 feel like degrees to lower at 108, but the emerge for the extreme heat over 2 hours, and that would trigger warnings. We also got the advisory lowered, and that helped us to really mobilize resources at lower temperatures to get the community aware. And that happened because of the advocacy, the coalition of data, and the political action of a mayor and the county. The Climate and Health Heat Task Force was also another innovative approach where health became center of what our outcomes and what our goals would be. We created workshops, we gathered information, we developed a research group that would track what the universities were doing and bring us together so we could share information from the community to these research groups in understanding what's really most important for our community. Where are the priorities? And then how do we tackle that? And we continue to meet, and we meet monthly where the data gets discussed. The challenges are very much aware of what the scientists and the community working together. And with the task force, we're also able throughout the year, as the heat season from May to October gets declared, getting us on one voice, getting the word out through all our different mechanisms with the different climate alliance groups. And there are about 20 different groups in Dade County that's working on these projects. Us with Florida Clinicians for Climate Action, we became part of the Goal 1 of the Extreme Heat Action Plan. This was the final culmination that the county then put together. This is after several years, starting 2016. Now we're in about I think this came out 2023, where we have our heat action plan with Goal 1, inform, prepare, and protect. And that first goal was where all the organizations got involved in how do we do this? And each of us would get funding and leverage dollars to be able to do this. Then Goal 2, cool our homes and emergency facilities. And then Goal 3, cool our neighborhoods. And every year, every action plan had multiple steps, as you can see. The leveraging the urban heat research group for continued learning, engage and prepare healthcare practitioners, which is what FCCA did quite a bit of work on through webinars sponsored by our organization and the health systems in Miami-Dade County, supporting outdoor workers, really mobilizing groups like We Count, which is a organization that supports outdoor workers and environmental workers to getting protection, and getting messaging which was consistent about what is an emergency, what is high heat index, what resources you can use, and build on every successive heat season. We also did in Goal 2, cooling their homes. You see all the steps involved then. That was incorporated in our countywide heat resiliency program. We invested in energy resilience. We identified cooling centers. We upgraded homes. We leveraged dollars for the community as much as possible. Then cooling our neighborhoods. The Dade County area has a 19% tree canopy. That's very small, one of the lowest for cities. And so there was a plan to take the expanding tree giveaway programs and increasing awareness, working with churches and other community groups to get the trees, looking at the areas that are mostly in need first, and really pushing the message of water and shade and rest, and planting more trees throughout. Also looking at getting the roofs of buildings painted white. And again, that targeted the lower wealth communities to be able to achieve that. And I used what we did at Florida Clinician for Climate Action to show you just how a nonprofit organization, which we are, a small group, how we leverage the resources. Multiply this, what we did, across the county, because many other groups like Sustain the Culture, CLEO, Catalyst, there are many of us who got different aspects to achieve different parts of the Extreme Heat Action Plan. Again, as a clinician organization, we were Goal 1, inform, prepare, and protect. And we were able to leverage dollars, which the county and chief heat officer helped us leverage. And that was to be able to get dollars from Kresge Foundation, Health Foundation, Miami Foundation, Baptist Health to support our education across the communities. So we educated in those communities that you saw in the first map. Those were the communities that we targeted. And those communities, we were able to get people in to educate about what heat does. We also develop community practicum through other dollars and help the medical students get part of the program. We then also, with our volunteer training program, and that's a picture of the volunteers who go in the community and they teach about heat, especially about heat stroke, heat risk, heat exhaustion. And we do a training program, we give them certificates. And that's because we were getting the support throughout the county and foundations to be able to do this. The literature that we distribute often came from county information, and they support a lot of the work that we do so that when we go for dollars, we don't have to spend the dollars in making literature. We can leverage what resources are out in the community. But what we do uniquely is that we then target our clinicians by bringing the ICD-10 codes and the Z codes and helping bring all the information together from the community to the clinicians and to the county and the politicians. So we bring all the data together to make it work. Our advocacy efforts also does the same thing, where the county, the doctors, everyone work with KCALOR to get a heat ordinance to protect workers. It was amazing that on the commission days, you'd have a university representative, a medical student, a community member, the county, everyone working together to support why we need heat legislation and protection for the workers. And that had never happened before, where all the forces came together, researchers, clinicians, everyone to say, we need to protect the workers. And this is what we experienced. This 2023 was our index pilot project year. And we got the 42 days, we monitored, we looked at our data showing the heat was, 2023 had lots of records, and we responded using this extreme action plan. The campaign reached millions of people. Our heat health safety training, 400 community disaster volunteers, employers, cooling staff, site staff. We updated the warning advisory, installed AC, bus shelters, planted 16,000 trees, and we were able to get $10 million, which unfortunately has been stopped. And those were to go in our highest areas of need. We also started getting some of the data out of the emergency department, and we haven't finalized the best way to collect this data, but Jane sent me this in 2024, looking at the 2023, where we had the lowest rate of heat-related emergencies compared to the rest of Florida, and we are the hottest. So we know that a lot of what we did had begun to pay off. And 2024, we'll have the data coming out soon to show how 2 years. What we do know by 2024 is that Broward County, which is our neighboring county, saw what we did and established the same system and replicated the same warnings and many of the same processes. I say to follow us to learn more, because unfortunately our governor have decided that all our actions and preempted everything. Our funding has been withdrawn, and our heat officer, the position is no longer existing. It was rolled into the resilience, again, because of the lack of funding. Our 10 million for the heat and the trees have been stopped, but we still continue. Many of our local organizations, because we've come together, we just had a celebration, the Miami Climate Alliance, we continue the work. And we're looking at other ways to mold and push the community forward despite some of the setbacks on the state and national level. Because as my patient says, we are blessed and highly favored, and the community is our currency, and our community will continue to protect our families, our friends, and everyone else during this heat crisis. Thank you.
Thank you so much for that. Thank you all for sharing with us. And I just want to sort of highlight what I heard, if I could put it in maybe 3 sentences, that local and state policies must be shaped by community input. I heard that a couple of times, especially from those most affected by heat. Public policy becomes a mechanism for prevention, not just response. And then data should be shared with the public in transparent, accessible formats to support advocacy and decision-making. So those were sort of my 3 takeaways from what you all shared. And so thank you so much for what you shared in your reflections. There are other reflections in the Q&A as well as questions. And so I do want to remind folks that there will be time 30 minutes after both panels for audience speaker exchange. And so we will have opportunity to pose any questions that we don't get to in these next few minutes, because we have a few minutes now for a couple of questions for the panelists that have already been curated. And then we're going to move into our next panel. So I'm trying to choose questions based on some of what has already come through in the Q&A. And I think a good one, a good place to start might be how do data gathering approaches change based on the audience for the data? And anyone can start with that one. So how do data gathering approaches change based on the audience for the data?
Well, I know I can go as a clinician or experience with the community. One of the things, traditional way would often have to have surveys and numbers. And in a community where oral tradition is strong and the storytelling is strong, qualitative data, I think, should be elevated, as folks say, really capture how the community shares their experiences. And I think that can be as equally powerful as if I could show this many deaths, like we did 31 to 100 deaths happened because of extreme heat. And that has to be somewhat prioritized in community so the community can understand, Auntie May around the corner got hospitalized because her apartment was so hot and she ended up with this. And that may translate better than telling me that 31 excess deaths happened because of heat. So that's how I feel we need to address how the community understands data.
Go ahead, Carrie. Yeah.
Yeah, I agree wholeheartedly. And I also think that those stories are not only helpful for communicating with individuals and communities as they think about the way that they're preparing and recovering and dealing with extreme heat and other climate emergencies, but also policymakers. They see a lot of numbers, and the numbers are important. And evidence is incredibly important, and that's the way that we want to base our policies and our and the way that we're building systems. But also, politics mean that people's voices and their stories are powerful, and it really can make a difference to be able to not only show that more than 500 New York City residents die every summer due to the heat, but also be able to say, here is an example of a resident of Jamaica, Queens, who has, told us about how hot they feel in their own apartment and how it makes them feel ill. And so I think that that the audience drives the way that we collect the data, but also those data can help influence audiences across the board.
Thank you for that. And when I was at the health department, we would always say, no story without data and no data without a story. So Walker, if you want to add something, go ahead.
Oh, sure. Just quickly, when the sort of a political will for developing Cal Heat Score was being developed, there was a real big push from communities to have a tool that was, data driven and taking this complex data to raise awareness about extreme heat's dangers. But also it needs to be a tool that sort of ambassadors of the tool can tell stories about how Cal Heat Score is driving extreme, or how Cal Heat Score is representing extreme heat. We want it to be sort of a train the trainer approach with this tool, where it's a tool that can be used by a wide variety of audiences, but also people can talk to each other about, well, you're seeing this number, what are the issues that you're facing in your community, and how can we support one another within the community? So it's a broad state tool, but it's also meant to drive hyperlocal solutions, and through that, stories are such a critical part.
Thank you for that. I am going to pull one question from Q&A before we move to the next panel, because a couple of you talked about partnering with community organizations. And there's a question here about how do you vet community organizations to ensure that they adequately represent and have the sufficient resources to reach the most impacted and vulnerable individuals for extreme heat.
I can,
you can, okay.
or Cheryl.
Go ahead. After you. Oh no.
Source question, which I think, and say.
So I don't know if you can hear us, Carrie, but you're freezing up on our end.
Oh,
So maybe
no.
we'll go to Cheryl.
Okay.
And maybe come back to you. Go ahead, Cheryl.
We as clinicians, definitely it's an important topic about vetting. Because how we teach the science and what we teach, we do have the training program. So if folks are not serious, anyone who comes from organizations that participate with us, we ask them to send a volunteer and complete our training program, our certificate program. And they have to invest the 4 hours. We also require them to show a video demonstrating what they've learned. And in that video, it's how they would teach. And that's how we've used the process that we're all on the same level. And we adjust it for whatever level of education. So for that reason, as clinician representing health messages, that's how we find the folks who will stay with us and work with us. Other organizations, our Climate Alliance allows everybody in, but the funding has to go to the foundations because that's where the funding comes from. And they then have the competitive processes. I wish they weren't so competitive, but processes to evaluate who can do the work.
Thank you. Go ahead, Walker. I see you unmuting.
Well, I would just mention that thinking of the word vetting, we're not vetting organizations. We're looking to organizations in California that we know are already doing important work in extreme heat. Me and my colleagues are not extreme heat in communities experts. We're not. We're designed to serve Californians, and the only way that we can do that is look to the important work around extreme heat that community organizations are already doing. So I think we're less worried about vetting and more concerned about just ensuring that we're working with people that are already experts and are already engaged in this space and have been for years and years.
I love that, Walker. Thank you for that. Carrie, do you want to see if we can get your jewels now?
Can you all hear me? Okay. Sorry about that. Yeah, I 100% agree with Walker and about the fact that we're really looking to partner with communities and community organizations. And I just wanted to add that on the resource piece, which I think is incredibly important, we need to be providing compensation to the community members and the community organizations who are providing their invaluable time and expertise to us. And that's something that we've really invested in trying to figure out how to do. Cheryl made a great point about big organizations like government organizations and using dollar way, but that's something that we've really tried to make sure with our climate resiliency advisory network is that we can provide not a huge amount of money, but some money to sort of to help compensate for everything that they give us.
Well, thank you all. We do have to move on to our next panel. I knew this would happen because there was so much interest and energy in this topic in general. But I do want to say one of the things I heard as well is the different types of expertise coming together to really address this issue around extreme heat. So this community expertise, the expertise from government, the expertise from community-based organizations, expertise from individuals. Even earlier, someone asked a question about leveraging media. And so all of these sectors working together to really address this issue. In the next panel, we'll talk about additional sectors working to address this issue as well. Thank you all so much. And I'm going to turn it back over to Anthony.
Thank you, Lucretia, and thanks all of our great panelists, Walker, Carrie, and Cheryl. for sharing your valuable insights and resources, which I hope many of us will incorporate into our own work. I will now turn to another amazing CCM member and co-lead of the group that planned this convening, Dr. Sheetal Rao, co-founder and chief health and engagement officer at Nordson Green Earth Foundation for panel 2. Sheetal, you take it away.
Thanks, Anthony. Hello, everyone. My name is Sheetal Rao. In addition to my roles with Nordson and the CCN, I'm a primary care physician on faculty in the Department of Medicine at the University of Illinois at Chicago and teach a course on climate change and health and environmental and occupational health at UIC School of Public Health. I'm honored to be facilitating panel number 2, private policy within organizations and systems to protect patients and workers. I'm really looking forward to this panel. Most of my patients in the communities I work with are at the front lines of extreme heat. Healthcare systems around the world are already seeing more frequent and intense heat lead to both acute illness and chronic disease exacerbations. Heat, as we've seen throughout this webinar so far, amplifies existing health inequities and it increases healthcare utilization and cost. But above all, the burden of heat's impacts on society is disproportionately felt by those who are already medically and economically vulnerable. We're delighted to welcome our 3 panelists, Lily Kelly, with the Grants and Contracts Analysis at La Clínica de la Raza, Jessica Hinshaw, Program Manager of Environmental Health for the National Association of Community Health Centers, and Maricel Pagan Santana, Director of Environmental and Occupational Health at the Migrant Clinicians Network. Similar to panel 1, each panelist will provide their remarks and we'll wrap up the session with a moderated Q&A. Lily, over to you.
Thank you so much. My name is Lily Kelly. I am coming to you from Oakland, California. My title is Grants and Contracts Analyst, but I'm here more in my capacity as the co-chair of our Climate Change and Health Working Group. And I'm also incidentally a co-chair of the California Primary Care Association's Climate Change and Health Working Groups. If you have any questions about that, please contact me after the presentation. But today I'm going to focus on our heat alert system, which is one of the first things we did when we first started our climate change working group. Next slide, please. So just a little bit about us as an agency. So we're a federally qualified health center. We serve about 82,000 patients a year. We're one of the biggest in the area. Lots I could say about this, but I want to point out first that if on the map, you can kind of see our service area, and there's a ridge of mountains that kind of bisects it. So you have the cluster of clinics right on the coast in Oakland, and those ones tend to stay pretty cool. But all of those scattered inland locations get very, very hot. So that was where we started when we first created this text alert program. We focused on the patients who live in that part of the service area, and we focused on heat and air quality as well. Next slide, please. So we started the working group after the sky turned orange. I guess it took us that long to take climate change seriously, but there was sort of a silver lining to this event happening, even though it was very bad and very deadly, unfortunately, and did harm our patients. But the silver lining was that it really brought climate change up to the top of the list for a while, which meant that we started our working group and other working groups started kind of around us as well. I think we weren't the only ones who were affected, of course. So that's kind of the origin of all of this. Next slide, please. I want to say a word about reducing our emissions. I'm focusing more on the patient care side, and I want to say that we've had the most success with the patient care part, more so than I think we've made in terms of changing our practices in the clinic. And I want to encourage folks to see this as a patient care issue more than changing your own practices. Much as I think we should all reduce our emissions as best we can, I think we've had a lot of success in getting organizational buy-in because we focused on the patient care side. Next slide, please. So I'm not going to go over all the details here of such limited time, but this is just kind of a visual of what it took to get this project off the ground, and the different departments and staff members and funders that were involved in moving it all forward. And again, please, take a look at these slides after, and feel free to contact me if you have specific questions about any of this. Next slide, please. So here's, again, just a quick overview of what we send out. So on the big wall of text with the bullet points on the right is the text. That was our, I think, initial draft of the text message. I don't know if, I think we've made some changes since then, but this was the first round. And then we have dot phrases in our EHR that help us kind of identify who needs to get what. And we have posters that we've also put up in patient areas of the clinics that has information about what to do in a heat wave. Next slide, please. So again, don't have to go into all these details, but since we're talking data, I thought I'd give you some of the data of how many folks have been receiving these to just kind of give you a sense of things. We didn't send them out to everyone. That's one of the choices we made. In general, we wanted to focus on the people for whom it was most relevant, because we don't want them unsubscribing from us, because that makes it harder for us to reach them in general. Next slide, please. We did some focus grouping, and we actually did some feedback collecting this year as well. So we've had 2 rounds of focus grouping for this. Again, don't need to go through all the details, but a lot of the similar things you heard from other folks, right? We had a general sense of that this is helpful, that it's useful to have it be very simple and clear, and it was information they didn't have. So they were happy that we sent it to them. Next slide, please. And again, not going to go into all these details, but this gives us a sense of, this was the feedback we got earlier this year, I think it was April, what the concerns are. And as was mentioned earlier, heating bills, or sorry, not heating bills, utility bills in general, cooling bills in this case, are a big concern. People are worried that this is going to drive up their bills and that they won't be able to pay them, among other things. Next slide, please. So here's just a quick look at how it may have altered behavior. Again, this is based on focus groups, so not a huge sample size. But this was the sort of thing that it tended to help people actually do in terms of changing their activities. Next slide, please. Yeah, and then again, looking at the resources they said they needed, places to go that were cool. A lot of the places around here don't have air conditioning. A lot of houses don't have air conditioning. My house doesn't have air conditioning. So it's definitely one of those things that if you live in a cool place, there's sort of pros and cons to that. If you're not used to it, you don't have the equipment ready, it can be a problem when the heat comes. Next slide, please. So here's the part that I really made for this presentation, and this is just a sort of set of tables of kind of what were the questions that we had and what were some of the resources we used to answer them. And then the sort of last slide of this is the known unknowns of the things that we don't have, the data gaps that we've identified. So, first is just kind of the logistics. Who's going to do it? Which clinicians are going to weigh in on which patients need to receive it? And there are more resources for that now than there were when we first started this back in 2021. What does the heat wave look like? How long is it going to last? What languages do the patients need the information to be in when they receive it? Next slide, please. And then here are some resources from the CDC about medications and diagnoses that make you particularly susceptible to heat. We've now, of course, reconciled this with the list that we made initially, but at first we didn't even have this. We were just, doing the best we could with the clinicians' knowledge that we had. Next slide, please. Yeah, and also this question of how are we prepared? Do we have the supplies we need for if patients present with heat stroke or heat exhaustion? Do we have the equipment, and advice also to give them? Does everyone feel familiar with this topic? Next slide, please. Yeah, and so this is, again, looking at like, what is it working, or is it changing behavior? And some of this stuff you really do have to just gather from focus groups. I'm sure there will eventually be more sort of available best practices and maybe scholarly research on this, but for now, a lot of it is we just have to ask. We do also have internal staff alerts as well, and so that's something that we haven't done a ton of yet, of looking at our own staff's reactions to these things. Next slide, please. Also looking at HVAC, is our HVAC system up to it? A couple of years ago, it wasn't at one of our clinics, and there was a heat wave, and the HVAC went out, and it got very, very hot. I think it was 85 degrees in the optometry clinic. So obviously that interferes with patient care, which we don't want. Nobody wants that. So we're now doing a whole review of all of the sites that are those inland sites to make sure their HVAC is prepared. Although we've had a cool summer this year, knock on wood. Next slide, please. So these are the known unknowns. This is kind of the fun part, right? For the purposes of this panel, I think one of the sort of prompts when we were preparing for this was, if you had a researcher on hand who could look into something, what would you want them to find out? So that was kind of what I was thinking of when I came up with these questions: is, does it reduce emergency department visits? Is what we're saying consistent with what others are saying, right? And we've heard from a few folks who are doing similar things, sending out alerts. So how do we make sure that's all coordinated? How do we make sure it's all internally consistent? We have heat protections in California. One of our questions in general is, are workers aware of these rules? Because the way the program is structured, workers have to report their employer, which means it may not be happening every time an employer doesn't implement the law. So that's another question that's kind of still an open one. And yeah, are employers abiding by the law? We need to know. Yeah, and then there's other things too that could probably be explored from a social media kind of reaction perspective, of like, what times of day are people most receptive to these? Is there certain language that helps? Does it help to have graphics? Does it help to have humor? Like, there could be any number of things that might increase or decrease engagement that we haven't dug into that yet. Partly, again, because it's been a kind of a cool summer, not complaining, but it means we've had fewer opportunities to kind of collect that kind of data. So we had kind of big plans at the beginning of summer, but the weather has just been very pleasant, so we haven't had to figure all this stuff out. But I'm sure it comes for us all. So we'll unfortunately / fortunately have opportunities, I'm sure, in the future to experiment and gather more data. Next slide, please. Yes, that's all I've got for you. I know I've probably gone over time, but I appreciate you being here, and I look forward to the rest of the discussion.
Thank you, Lily, so much. There's a lot of great information there. I'm now going to move over to Jessica.
Yeah, thank you so much. Hi, everyone. Jess Henshaw coming to you from the National Association of Community Health Centers. Just wanted to say a big thank you to the Climate Communities Network for having us on today. And I just wanted to also say a big thank you to my panelists, my co-panelists here. I have just had a great opportunity to work both with Lily and Maricel, and I have learned so much from them. And so you'll see me referencing both of them throughout this presentation. And so I just love working with the both of you so much. Next slide, please. And I guess before I get started, Lily presented a great overview of what a community health center is. And so now maybe I'll zoom out a little bit more. So for those who aren't as familiar with community health centers provide primary behavioral and dental health services all across the country. I have some notes up here because our research team at NAC just put out some new numbers. So back in 2024, so last year, health centers provided health services to almost 34 million patients, which is huge, and it increased from the previous year. So that means 1 in 10 people in the US are a health center's patient. And then health centers provide these services to predominantly low-income communities who we know are the most impacted by these heat issues. And they also provide a lot of services in rural areas and to outdoor workers. So there are 1,500 different community health center organizations across the country, and they operate 17,000 sites. So they are the largest primary care safety net network that we have in the United States. And so in my role, I've been able to learn from community health centers like La Clinica and many others about what they're doing to prepare inside their organizations and work with their patients related to heat. So I've kind of synthesized these lessons learned into what I'm calling the 3 Ps here. So providers, places, and partnerships. Next slide, please. And so I'll start kind of going through what we've learned on the provider side. So Dr. Holder already referenced this, but there are some amazing resources out there already. These 3 that I have on the screen were either co-created with community health centers and other safety net clinics, or they had significant input from them. And I'm totally remiss because I did not include Migrant Clinicians Network's heat resources. They have some amazing ones, and I bet Maricel will touch on them, but they have some great ones that are really focused on community health workers. But here we have the CDC's heat resources. They have patient action plans specifically for some different patient populations like pregnant people, those with chronic diseases, as well as children and youth with asthma. And they also have an amazing heat risk dashboard where you can type in your zip code or your city or your town, and it will show you a heat risk forecast for the week. We also have Harvard's heat risk clinical alerts up here. So providers or just anyone in general can go and put your email in here, and it will, and where you're located, and they will send you an alert anytime there is a heat risk in your area. And then there are the AmeriCare's heat toolkits, and I know for a fact La Clinica was able to give some great insight to these resources, but AmeriCares has developed out these toolkits for heat, for hurricanes, for wildfires, and they have tip sheets and action plans, and they also have this new function where you can type in specific information about your organization, and then it will point you to resources that can be very helpful for your specific organization and your area and in your level of development. So next slide, please. So using these resources, last year we were able to host both interviews with health center providers as well as a learning collaborative. And specifically in the interviews, we were asking health centers about the CDC resources. So this was done in partnership with the CDC. And what we asked them was, how will you use these heat resources in your work? Like how can you implement them? And sorry, my dog is here and she's now barking. So basically what we heard from them is they would use these resources in waiting rooms, print out materials when it makes sense and have them around the waiting rooms. They would use these resources to craft social media posts. They would work with local media such as radio stations and newspapers to write op-eds, to describe heat and health issues, to get the word out about heat and health. They would incorporate these resources and conversations and patient visits. And what we learned is, unfortunately, health center providers have less than 2 minutes to talk about heat with their patients. So not only should these conversations happen between like a doctor and a nurse and a patient, but also think about the front desk staff. Do they have a role in sharing about heat harms of health with patients as they come in? Can some of this work be done through community health workers as well? And then we learned that health centers are very interested in alerts, just as Lily described, through electronic health records or text messaging platforms. And then health centers are also really interested, and they think it's a good avenue to explore how heat preparedness can be integrated into requirements that they already have for their emergency operations plans, which is a CMS requirement. So next slide, please. And so after our interviews, after our learning collaboratives with the health centers, we were able to either augment some of the resources that already exist, or create some new ones. So, or summarize great lessons from health centers. So here we have a heat and health basics webpage at NAC, and you'll find a lot of resources there. So we have a quick action guide. So just some initial steps that health centers can take to get started when they're thinking about addressing heat. We have a micro learning module that goes through the CDC heat and health resources. That's really aimed for busy health center clinicians to get acclimated to those resources. We took the lessons learned from La Clinica and put them into a heat-related illness management and EHR systems, which is really all about how health centers can set up alerts inside their EHR systems or use text messaging platforms. And included in that guide, we actually have an Excel sheet that has data elements. So those health diagnostic codes that folks can use to identify patients that are at risk from heat issues. We have created a heat tabletop exercise, which health centers can plug in their own, or any organization can plug in their specific information to the tabletop exercise and use it as an exercise at their organization. And this can help meet one of those CMS requirements that health centers have for their emergency operations plans. And then we had a webinar series with Migrant Clinicians Network that covered different heat topics, and especially one that I would highlight there is heat and mental health. And so all those recordings are also on our webpage there. Next slide, please. And I'll move faster because I'm going too slow. So the next P that I have is places. Other folks already covered this in some of their presentations, but we know that health centers are acting as cooling centers. They're acting as water stations. So specifically in Arizona, there's a health center that has just set up places where people can fill up water, or they can take a water bottle out of a refrigerator whenever they need it for free. And then something that is kind of a hot topic right now are what we call power and emergency hubs, but other folks call them resilience hubs. So health centers having reliable backup power and being able to serve as resilience hubs, both for heat events, right, but for other natural disasters as well that impacts the power grid. Next slide, please. Some resources we have for health centers to think about enhancing their facilities, their infrastructure is the Charge Partnership, which helps health centers install solar microgrids, which provide reliable backup power to health centers. I'll throw that information in the chat. And we're also coming out with a community health and power hub playbook. So essentially a resilience hub playbook that takes lessons learned from health centers that have already begun this journey of becoming a resilience hub. Next slide, please. And then finally, I'll finish with partnerships. We are working with a number of partners that include health centers, community-based organizations, the Environmental Defense Fund, Texas Southern University, and the Deep South Center for Environmental Justice to bring together health centers and community-based organizations to develop both local disaster plans, which include plans for heat in Texas and Louisiana, and then also taking all those lessons learned and bringing them up to a national level to create a framework or a guide to bolster local connections and collaborations for disaster planning and response. So I'll just leave it at that. And the next slide just has some contact information. And I think I will now kick it over to Maricel.
That's great. Thank you, Jessica. And yes, Maricel, please go ahead.
Thank you. So my name is Maricel Pagan Santana. I'm the Director of Environmental and Occupational Health of the Migrant Clinicians Network, and currently I'm located in San Juan, Puerto Rico. I want to give you and continue the conversation that Jessica just started as well, Silly, about partnerships. I will be focusing on a model that we use to address emergencies, and this model was born out of a program that we started in Puerto Rico after Maria happened, which was aimed at just flooring and hurricanes. But as we have evolved in the But climate change and some of other disasters, we have been evolving in the content of the model to address other emergencies like heat exposure. So I'll be working on that from the perspective of protecting workers. Next slide. And on that note, sadly, we keep seeing cases about workers being exposed to heat and dying because of it. Just recently, we saw the death of Marco Antonio Hernandez Guevara on Florida because of heat exposure. He was an H2A worker. And you'll see on my next slide how our heat protections are limited when it comes to workers. So we don't have a federal heat standard. There's a proposed one that has been roaming around since 1972. And we were really optimistic in 2024 and hoping for a final rule in 2027, given the current situation in terms of policy and government. We're not sure that's going to be following through, sadly. We do have some state regulations, like Lini mentioned, California has their, Washington, Oregon, Minnesota, Colorado, Maryland have their own safety, health and safety standard to protect workers from heat. But as you see, it's really limited. There's some state that has some kind of organization and guidelines around it, but sadly, we don't have a national standard to cover our employees and protect them from heat, which is now becoming more and more a hazard to what they're doing their work. Next slide. So in our work on Migrant Connections Network, you'll see that we're going to be focusing, and can you click on the slide so it shows the numbers. So you know the likelihood of a death from heat-related illness is riskier depending on the work that you do. So construction workers and agriculture workers and farm workers are highly at risk of dying from heat-related illness. And when we're talking about construction workers, keep in mind that that involves the people who are going to be in charge of recovering processes after hurricanes and other disasters. So, and this is important when we come to talk about community mobilization and response out of the community health centers and other institutions. Heat is an issue when we are out as first responders, just out of a hurricane. There's a lot of humidity, a lot of heat, and their exposures become an issue. So what we have been talking to health centers is how to get disaster volunteers, construction workers, and farm workers who are related to the food security, especially after a disaster, to be protected. And how to get that, I saw Lily's system integrated within the clinic, and now what we're focusing out of the clinic, how to get community health workers involved with leaderships in community to move forward with training. And hopefully you see there construction workers 13 times more likely to die from related issues, and then farm workers 35 times more likely. And when we talk about emergencies and we talk about climates, these two industries are the ones that are our first responders, right? It's about food security and it's about rebuilding and responding. So also, these are our populations that usually are underserved and unsecure in terms of medical insurance. And we need to work on that. And part of our model for community mobilization is to increase literacy around climate and promote preparedness around climate and heat within community, but in partnership, like Jessica was presenting, in partnership with community health centers. To give you a little bit of more context, when Maria happened, our community health centers were the central hub for emergency response, which means they are directly connected to receiving supplies, government, but they also were the most knowledgeable about what was happening in the community. So without that central hub, we were not able to move and understand what the needs of communities were. So building on that is that community mobilization process for emergency preparedness, and that's how we're working. Next slide. And this is just a pillar that we work with that in 2023, and I'm highlighting the relationship with community and partnerships. So it's a recognition that without those partnerships, a comprehensive community mobilization process to protect communities from heat-related exposures and environmental disaster emergencies is not possible. So it's not just infrastructure, we need clinical training and support, mental health and well-being for our staff who are going to be addressing the people who are affected by the emergency, but also that relationship with community, that trust with community, to be able to rely on them. So when we talk about the workers know their rights, who's going to be training them on their rights, who's going to be supporting them. So we work with community health centers, and they use a community mobilization model to train community leaders for them to be able to train workers rather than an external entity to be entering and training those workers. So it creates a relationship, it creates a trust, and it also provides space for advocacy and leadership within the same workers and the same communities. Next slide. As results, I'm going to be mentioning our work, but also other partnerships and similar models. In Florida, there's the Coalition of Immokalee Workers. They do have the Fair Food Program, which aims at creating a labor, and employers are part of that program to promote worker health and safety. So when you are a buyer, you know that the food that you're bringing to your home comes out of a farm that is following good practices to prevent worker exploitation and to promote health and safety. So that's an example of community mobilization that involves not only the employer, but also the people who benefit from the food that is getting processed. And the community mobilization model that we use in Puerto Rico has now become a really big curriculum that we are soon to publish. And we're trying to get all those resources that part of what Jessica just shared, just to make it a really just one-stop place and divided in different literacy levels so people can share where they at in terms of climate literacy and what their need. But the purpose of the community mobilization is to get the community involved, being supported by the health center, but also have space for advocacy and when we are seeing gaps. And an example of what we have done recently, Puerto Rico doesn't have a standard of heat protection. And we started exploring with a health center, should a standard be published, are people going to be promoted in an agreement with the standard? And seeing what the understanding about heat workers and the food in your table is. Same with Virgin Islands, doing a town hall, health centers promoting a town hall to discuss if you know the relationship related to heat and the food that you have in the table, and how we can protect those workers and prevent them to be sick because of heat and other environmental exposures through advocacy, but also to partnerships and structures around the community health centers. Next slide. And then I'll be sharing resources in our breakout rooms. I'm not sharing it now, so we can be just mindful of the time. But just keep in mind that if you log into a Migrant Credentials Network website and sign up for our blog, you'll see the release of the resource that has all the inventory of recently provided resources for clinicians. Thank you.
Thank you so much. Thank you, all of you, for sharing your important work and your expertise. We are able to see the role of community health clinics in protecting patients and workers in the setting of more frequent and extreme heat. All of you highlighted some really great resources, and I know we'll be sharing those out, as well as the importance of community feedback and even community involvement to the success of all of your programs. And then you all spoke about the equity concerns around extreme heat and health. So I'd like to begin our moderated discussion. And I have a couple of questions. I know we're pretty short on time, but I wanted to start off actually with a question for Jessica. And that question is, what is your role or your organization's role in creating policy or policy development related to the impact of heat on health?
Yeah, that's a great question. So, our I will just speak for myself. I am on our programs side of things, so I am not directly involved in the policy shop at NAC. But NAC, our policy team right now is very concentrated on issues related to Medicaid funding for health centers, Section 330 funding. So just thinking about that, well, that's not necessarily like your mind isn't like, wow, this is heat policy. It's really to keep health centers help maintain their ability to keep providing care to their patients, which is really what's needed. Health centers need to maintain their funding so that they can keep their doors open, so that they can keep their patients healthy and their communities healthy. For policy work on heat, there are other organizations that are really leading that work. So for instance, the Medical Society Consortium on Climate and Health leads a working group, a heat working group or heat alliance. I might be getting that confused what they're exactly called, but they have coalesced a number of different organizations who have an interest on heat and put together like single sign-on letters or organizational sign-on letters and things like that. And we do participate in that working group.
That's great. Lily or Maricel, did you want to weigh in on that question? Go ahead, Lily.
Okay. Well, I don't have much to say on this because we haven't really been involved in that. California went ahead and put in heat protections all on its own without us having to be involved at all, which we're very grateful for. I think it might have gone differently in terms of, you know, for example, like I would love to see, and I'm just speaking for myself here, I'm not even saying this on behalf of the organization or anything to be clear, but like I would love to see random spot checks to make sure during a heat wave that employers are abiding by the laws that we have in place, as opposed to putting the onus on the workers to report. So there's things like that that I feel like it would have been good if we had been involved, but we weren't.
What kinds of data and community input drive decision makers to act? I heard emergency room visits mentioned in one of your presentations. Is that one of the most compelling pieces of data that you've seen, or are there other ones that you would like to share? And this could be anybody, just go ahead.
I think the emergency room data is very compelling, but I also wanted to go back to what the panelists on at the first session were also saying, that those qualitative stories are also really important. So for instance, qualitative stories about patients who have been able to access LIHEAP, for instance, to be able to get support for their electricity bills, or those stories about patients or outdoor workers who are impacted by heat, I think are incredibly important to this policy and data conversation. So I just wanted to raise that again.
Did anyone else want to add to that?
Yeah, yes, yeah. In addition to that, usually interruption of productivity or what a normal day should look like, specifically with schools. At least in Puerto Rico, where schools are not likely to have a central AC or HVAC system, there's a lot of interruption coming out of that. There's a lot of interruption coming out of the electrical infrastructure because of demand. So that's a lot of information and basically money that goes to the loss of infrastructure because of power and demand, and then the interruption on school days. Comes to a lot of public discussion when it comes to heat.
Yeah, that's a good point.
I want to add that, yeah, just the emergency department visits tends to be something that has in the past been emphasized as part of the role of community health centers, is to keep people out of emergency rooms. And so that is something that has been central for us in terms of, you know, justifying putting efforts into this. And I want to say too that, you know, sometimes your decision makers are bad faith. Okay. And I just want to like, you know, bring that up because I feel like sometimes and this is kind of getting at the question from earlier too, of the audience and how they affect the way you collect data, right? Like for some folks, they're going to only be convinced by certain things. You can talk all day about people dying of heat and they won't care, but they may care if it's going to cost their hospital system money, or if there's another entity that does care, that they care about. So I think we need to be creative about how we approach some of the decision makers who just aren't ever going to pay attention to climate change related stuff that's going to make their brain turn right off.
Could I add one
Sure.
more kind of, I think, important like data point also, and it's kind of going again back to the stories, is like we focused a lot on patient outcomes, which I think is incredibly important, but I also think we need to focus on the organizational stories as well. So from a health center perspective, and this isn't exactly heat related, but it is fire related. Health centers in LA, when the wildfires occurred, were the first and the last responders on the ground. And we have to highlight the importance of our nonprofits, of our hospitals, of our health centers who are embedded in the local community and show up when they're needed, because that's just incredibly important for so many conversations, whether that's funding to support these organizations, to just highlighting the importance of these organizations to our policymakers, both at the local, state, and national levels. So just wanted to add that in as well.
Thank you so much. This has been very insightful. We're very grateful to you for sharing your expertise. You're all doing wonderful work. With the lack of time, I apologize for not getting to a lot of the questions in the Q&A, but there will be additional opportunities to get those questions answered. So with this, I'd like to turn it over to Anthony.
Thank you, Sheetal, and all of our panelists, Lily, Jessica, and Maricel, for another fantastic discussion. So now we'll move into the audience exchange, where the audience will have the opportunity to reflect on the presentations, uplift considerations, and engage with panelists in a multi-directional way. So there are a couple different ways to participate. You can come off mute and ask a question. So please utilize the raise hand function, and staff will invite you to come off mute at the appropriate time. For written questions, please utilize the Q&A function located in the Zoom toolbar. And then with that, I'll turn it over to Sheetal and Aprecia again to change. Over to you both.
So Sheetal, I
Thanks,
feel like
Anthony.
you were just talking. You just came off of talking, so I'll give you a little bit of a break.
Thank you.
I'm going to go ahead and start with one of the questions that was in the Q&A, and then others, again, feel free to engage the ways that Anthony just suggested that you could. You're invited to do so. But just getting back to a question that was posed earlier, which is directed toward that first panel, and this is from Todd Liu. Have there been evaluation studies on whether these plans, so the plans that you all talked about in the first panel, and collaborations have led to reduced number of heat stress deaths? And then the caveat is, I know this is very hard to measure, but I was curious. So I wanted to sort of start with that one to get us thinking about data again. I know there are a lot of different streams of thought that are coming up around this topic, but wanted us to get a little bit back to data. So go ahead, Lily.
Well, I love to hear what Cheryl has to say also, but I did just want to mention there was a recent article from, I think, the JAMA, I think it was Journal of American Medical Association, about this difficulty of measuring what of these deaths are actually caused by this event or by climate change, or how much of that can be attributed. And there's hopefully going to be more sort of standards and practices around that. Unfortunately, we're having to develop those, but that is still kind of an open question, I think, or a problematic question. And it gets back to this question of data. How do we define the parameters of how we talk about these things?
Cheryl?
Mm-hmm.
Yeah, in Miami, we have the same challenges that Lily just talked about. And also clinicians and coding isn't clear enough, and that still needs a lot of work. Our EHRs are behind. And most recently, Dade County has been able to work with the medical examiner's offices to really put heat and temperature on these reporting. So it's very early to really do that cause and effect clearly. We still see the correlation. And we are going with that, knowing again what our patients and our community are telling us. But I think it's probably another few years for Dade County to really show the data and give us some better information that works for the scientists and the funders.
Thanks, Cheryl. Walker, did you have something to add?
Yeah, agreed regarding sort of medical system coding issues in California. You know, we can look at the emergency room visitation data after Cal Heat Score's been out for a few years. It takes time, but you know, there are other sort of innovative ways to look at it, right? So California, and I know some other states have this syndromic surveillance data to get a sense of in more real time, you know, do we see lower than sort of baseline rates after a system or series of warnings have been out? Looking at EMS call data, and then just going back to, you know, other ways of collecting this information and getting input from communities. Is there increased awareness? Are behaviors changing? And so are there different sorts of resources available to people, right? So it's not necessarily just a, you know, decrease in morbidity, mortality that we're looking at, but we're trying to expand the different metrics that we're using to evaluate whether these systems are effective.
Thank you, Walker. I'm going to move on to a different question, and this one's from Nidal Rashid. Given the consensus on funding limitations and the proliferation of state-level heat surveillance programs, what steps could the NAM or federal partners take to incentivize integration and data sharing so states can leverage a unified platform instead of working in silos? It's a tough one. Okay.
Anyone from NAM here?
Yeah.
I can jump in even though I'm not part of the first panel. I can give an example of something that's going on in a program in Puerto Rico. So we noticed that there's a lot of initiatives around climate and mobilization and heat monitoring and air quality monitoring. So there's a program going on that its only purpose is to gathering of the partners. So it's creating a network, and they meet frequently just to discuss what everybody's doing and trying to think together about how to create that unified system and make sure that we're not duplicating efforts. So it will take partnerships, and it will take time to just sit at the table and start talking about. And I know sometimes some organizations can get a little bit protective of the programs that they're doing rather than sharing. But it takes a trust level between partners and sitting down at the table and make sure that we do not duplicate and try to make that happen. So there's a lot of initiatives going on, and partners needs to sit down and talk to each other differently.
Thank you, Marisol. I think it's so important in light of how quickly climate change is moving and how quickly heat is intensifying that we don't, everyone doesn't reinvent the wheel by themselves. There's, as we've seen today, so many amazing programs going on, and I like to see those examples of collaboration. Lily?
Yeah. Thank you.
Yeah, I think this is just a great example of something that we're seeing a lot of now, right? Where there were federal level systems that are not going to be as available or reliable, you know, for going for at least a while. And I think that we're having now to sort of try to figure out how to replace that in some way, and create networks that can be self-supporting and self-reinforcing. In the absence of, you know, the National Weather Service, for example, you know, if they lose funding or whatever, if they become less reliable, we have to, you know, I think look at other ways to do this at other jurisdictional levels.
Yeah, on the clinical side, you've heard Jessica talked about the Medical Society Consortium, and they are working together. In the consortium, the climate action states were at least 32 across the states. Also, Healthcare Without Harm And even Duke has a whole climate heat, what is it, council? It's a group, it's just a whole research department. And University of Miami is working on it. So I think through the medical aspects and some of the community, we're seeing working together and collaborating on the research and on the work. Not having federal dollars is huge, and we'll see how that works. But I know on the health system side, we're working together.
Thanks.
Thank you.
Yeah, and
Definitely.
adding to what Dr. Holder just shared, and I think Maricel, and then I'm seeing Nidal's comments here in the chat, whether it's the Medical Society Consortium, who's already doing great work, or NAM, or I feel like NAM's work and the climate collaborative kind of going through that process and mapping out, they did it more for like sustainability resources, but mapping the different sustainability resources that were in existence, kind of mapping those out and putting them into a sustainability map. I wonder if that could almost be kind of like a guide for what could happen with different heat data and heat resources. So just, having a convening body that can get us together, map out what data and resources already exist, how we can synthesize them, and if it makes sense to put them in some kind of shared map or database, or maybe it's creating a story map that showcase how different states and different localities or organizations are dealing with heat. I feel like could all be really helpful resources, but maybe just a mapping of resources could be a great place to start.
Definitely. I don't know if you'd like to come off mute, but Nidal had put in a great comment here, and if not, I can just read it. All right, so what she said was one idea might be for NAM or federal partners to convene a working group on heat surveillance integration, bringing together states, NOAA, public health agencies to create shared data standards, funding incentives, and accountability metrics. And that way, every dollar supports a unified system with real measurable outcomes for communities at risk. And then Manny J added, this is a great idea and should include climate health and environmental health informatics as well. So does anyone want to comment on that or add to that at all?
I think it's a great idea also, but funding is important. I think we're looking at recently Robert Wood Johnson. I know with Robert Wood Johnson and the Gulf Coast, that has helped started looking at monitoring. And so I think bringing in funding partners, I don't know if the federal government is ready yet for jumping in this area, but I think the foundations could play a very big role in doing this.
I have a question here from Josh Glasser, and it is, how can we reframe public health and healthcare as critical resiliency infrastructure akin to power, water, and public safety? The hard work is being done, but the resources are not there to match the work and the need. I know it comes down to resources a lot, which is a difficult thing right now. But any ideas on how we can reframe this? We are seeing with different things, storms, heat, that the ability to give care is being impacted severely. And so just looking at how can we keep the doors open as a healthcare system and still be able to treat patients in light of all of these occurrences. Any ideas or thoughts on that? Oh, go ahead, Pearsall.
Again, I think it's about partnerships. Sometimes health centers are not able to make the push in advocacy because of their position, but you have really powerful partners that are able to make that with you and for you. So creating partnerships and making sure that you not only are recurring to other resources and getting creative in terms of how the get to your health center, but also making sure that the advocacy piece and the legislation and funding and resources allocation goes the way that it needs to go. And for that, you need to make your community aware of the challenges that you are having and make sure that you have really good partners that are willing to go for you and do what you are not able to do.
Carrie?
Yeah, thanks. I can speak to this from the perspective of the public health and government organizations. So one of the things that we've really been leaning into in collaboration with NACCHO, the National Association of City and County Health Organizations, is really leading into public health superpower, which is our data and our surveillance. We're very good at that. And being able to demonstrate the burden of heat, of other climate disasters in other spaces, not just the healthcare sector or the public health sector, but going to the energy sector. In New York City, we work at the health department and participate in the rate cases that are generated by the utilities and bring our data to bear in order to push forward, for example, disconnection protections during heat events. And so I think the more we can lean on what we already do and then bringing it into these spaces where maybe not everybody's always thinking about health, but when you get a seat at that table and can, it brings a lot of.
Sorry, Carrie, we're losing you a little bit. I think we missed some of the end of what you were saying. We'll move on to Cheryl, and then we'll let Carrie finish up maybe in the next one.
I'll tell you an example that we're trying in Florida. The Tampa Bay Resiliency, they have to put out a plan every how many years, and the new plan is working on. We've been trying to insert health in all these resiliency since they have millions of dollars. And what they've tried now is that the engineering consultants on a project have to submit a grant as a competitive grant to include the community organizations from the beginning in how to get the word out about the Tampa Bay Resiliency Plan and also getting the community input as early as possible. So the main leader of the grant has to be a consultant, and I'm working with a group that's going to put in about watersheds and flooding, which is a huge problem. Then how do we incorporate the health message with that group and about 10 other community partners, and we're going to work on getting funded. Unfortunately, it's not going to be every group because it's a competitive process again, but it's the beginning of getting the public health and the community involved and getting funded to be involved. So we'll see how it works out.
Absolutely. The health message is really important. Getting the community involved is really important as well. And Carrie, thank you for your message in the chat. But absolutely advocating for using public health surveillance and data in non-health spaces, which are the social determinants of health, like housing and energy, is really key. Jessica?
So I know this question was about like public health in general, and so I'm sorry I'm taking us down the community health center track, but that's the world I live in. So I just wanted to say for community health centers, to really bring them into this and their importance in this. We have heard from the Primary Care Association in Massachusetts that they have been able to get some of their community health centers listed as critical infrastructure. So I think having health centers work with local governments, state governments to get themselves listed as critical infrastructure so that when the power goes out, whether that's from heat, a hurricane, whatever, their power will be restored more quickly with other critical infrastructure like hospitals. I think that's really important because if health centers can keep their doors open, keep seeing patients, that keeps people out of the emergency room departments. I think another really important story to tell is that when we do have these natural disasters, and the power goes out, or just if there is a power outage because of the aging grid infrastructure, we need to be able to communicate how, when the power goes out and our health centers or our other healthcare facilities are not able to keep seeing patients, what this looks like from an economic perspective, and also what it looks like from an emergency perspective. So for a health center, we've done some initial research, and a health center, when they have to close their doors from a power outage, they're not being able to see patients results in about a $40,000 loss per day that they're closed, and revenues. But that also means something, that the patients are not getting that care as well. So I think those are also, the financial aspects are really important to communicate along with the patient level impacts.
Absolutely. Sometimes that's the message that gets through, is the financial one, unfortunately. Thank you for that. We have another few good ideas, again, great ideas actually, in the chat. So just make sure you take a look at those. I have some questions in the Q&A. Lucretia, did you want to pick a question?
Yeah, since Jessica sort of took us back to health, physical health, in terms of in the health system and healthcare. There's a question posed. It starts off with a comment, but I work with health data from small communities in Indiana, and I have noticed that there are very few explicitly heat-related ICD diagnosis codes, even when we look at long-term data, say 10 years. Do you notice the same in your analysis of heat health data? Do we just use proxies in cardiovascular, renal, respiratory?
As a doctor on the panel, absolutely. And that's one of the big areas that we see. And that's why we're working. There's a project at the University of Miami that we're working on and trying to figure out how to best use existing data, collecting data, and then upgrading the electronic health record systems. I know NAM was working on the project with a group. I forget the group that does all the EHR's approval. I don't know if NAM person is on, for the same reason that our ICD-9 codes are not sufficient to capture the data well. But different institutions are working on different levels, but it has to go to the electronic health records to make this work at all.
Yeah, I would second that. I mean, so much depends on the EHR system. I'm not a clinician, so Dr. Holder obviously has a much more detailed view of this, but that is something that comes up a lot for us. Can we have more, kind of what we talked about before, right? Pop-ups or something in the EHR that's easy to either pull reports down, right? So things like the ICD codes that can correspond to what we're interested in. And also information that the EHR will pop up and say, hey, this patient is in an area that has high risk of heat, or this patient went to an ER recently for heat-related illness or something like that. I mean, there's so many different ways you could slice it, but all roads lead through the EHR for sure.
And maybe what I can add too is our health informatics team at NAC did a big lit review and pulled all of the relevant ICD codes related to heat. And we have them in a spreadsheet. It's a data element spreadsheet. I think it is linked in our the guide that was in my presentation, but that is totally publicly available. We're happy to share that, and it obviously includes Z codes as well. So I think, yeah, if that's at all helpful, happy to share that along to the NAM collaborators.
Yeah, and there's also, again, Sheetal has already said this, make sure you're looking at the chat. There's also a response to this question as well that gives a little more information and insight in the chat.
Yeah. There's a great question here from Todd Liu. And does anyone have any experience working with labor unions or employers whose workers are at risk, and maybe have some guidance around that or a success story that they could share? Or a not success story that we could all learn from as well?
I can tell you one on the way success. we got very close to getting the heat ordinance guidelines for our outdoor workers and our nursery workers in Miami-Dade County, with clear guidelines, what steps, what triggers, what to do, and it was preempted. But a huge construction company, there's a group up in Harvard also that did similar work with the biggest construction company, I'm blocking on the name, that has done it for their workers in monitoring, putting shade on their construction workers, and demonstrating improvements. Our group here that we count has started working with Swerdlow Construction because there cannot be a local or a state, or we don't have OSHA guidelines, in having them look at their productivity and providing some sort of work, some sort of protection. It's in negotiation, it hasn't been done. But the tomato workers in Immokalee, they worked with their union at the time when the contracts were the amount of time to pick, that they got some protection for heat during that contract, because the problem with picking and the way the farm workers work, it's like per piece. And so if they were to take a break, it impacts their income tremendously, so they don't stop. And the tomato workers in Immokalee were the first group in Florida that were able to negotiate in their contracts some protection. So there are bits and pieces of successes out there within Florida, even though the state has ruled against us.
Yourself. So partially successful, not so successful story. So we have worked with the teachers union. So here in schools have been a really big issue in Puerto Rico, especially recently, like 2-3 years. We had students basically fighting employers and employees, like having an issue of maintaining cool spaces. We made it to the desk of the secretary of the Department of Education, and they are really willing to do all the outreach and educational piece of it. But when it comes to investment for industrial high-end interventions and engineering of the schools, that was kind of like the no-go. So it felt a little bit like a band-aid. Acknowledging the issue was good. Training and capacity building is always good, but it did not resolve the issue, and it continues to be an issue. So um, the part of the investment, even though you can prove that investing now is going to have a return of investment really quickly and it goes beyond what you can think of, it's not on the priorities when you look at some of the employers. So they're really good at doing the outreach, education, training. They're really good at providing time for that. But it comes to investment that are really a little bit beyond just letting people know what's going on. That's the hardest part, and I don't think we have been successful at moving toward that engineering process to cooling places.
Thank you for sharing that experience. Actually, along the lines of occupational heat risk, there's a comment here from Maniche, and I'm so sorry if I'm saying your name wrong, about the La Isla network. And I think that Cheryl was mentioning that as well. And I saw that recently came out and had shown basically that really it increases productivity when when these employers institute heat protective actions. And so thanks for sharing that resource. And then John Balbus, I don't know if you were willing to come off mute to talk about your comment, or able to come off mute at the moment.
Sure. Still here. Just a lot of discussion, great discussion in the chat about the use of EHRs. And I just wanted to highlight some really groundbreaking work that Emblem Health, and Insurer in New York City, is doing. Carrie's probably very familiar with it, where they are they're combining the EHR, analysis of their own data on their own patients in the EHRs to identify most at-risk patients, combining it with the health vulnerability index that Carrie described, and using agentic AI, which is, very 2025, right? Apparently to good end. I'd be skeptical of it, but apparently very well received, that there are AI, basically bots, contacting patients, engaging in conversation with the patients, and providing guidance on how, individualized guidance on what they can do to help protect themselves in heat. So just, these ideas that are floating around are starting to happen. And as the point is being made, start and finish, I'm sure we'll hear this from Grace at the end, it's creating those communities of practice and sharing these, evaluating them carefully, making sure that they're actually working, being able to, put data to them, as we said, to the story. Charles said that, and others. And then just sharing the information in a community of practice.
Thanks, John. Let's see what other questions we have here. Lucretia, I don't know if you had one in mind. I don't want to take your chance to pick one.
You don't want to steal my
See.
thunder here.
I want to steal your thunder. Yeah.
There was one that was related, and I think you started touching on it actually. Julie Robinson asked, can anyone provide suggestions for resources that provide economic analyses on the bottom line benefits to employers for providing heat safety protections and procedures for outdoor workers and farm workers? So I know there's been a lot of resource sharing in the chat. So if you have resources, maybe that's a place to share those resources as well. But if anyone wants to come off mute and share, point Julie in the right direction for those types of analyses, or whether that's just a gap and there aren't those types of analyses. But it sounded like Shatala, you were saying, you were mentioning some studies.
Yeah, there was the one that with La Clinica, or sorry, La Isla that was mentioned in the chat that I saw recently. And I think they measured productivity after instituting a set of heat worker protections, and they were able to show that the productivity improved. Because I know that's, of course, a large concern, because this is when people get sick and they can't work, that obviously costs the employers money outside of the health concerns around that. And so if we're able to show, and there are a few studies out there that do show that productivity is actually improved when the employers institute these protective measures, I think that's really valuable because a lot of times business owners are concerned, understandably, about the bottom line. And when we can show that type of data, it could be really effective. I see the American Industrial Hygiene Association might have those kind of resources as well. And Dr. Holder shared a resource again in the chat. Dr. Adrian Wald gave testimony on the hearings for the proposed national heat standard. So thank you for that. Let's see. Does anyone else have anything that they didn't get to share that they'd like to touch on or speak about that you think would benefit our listeners today? Very open-ended question. We have, here we go, the business case for action here in the chat. And then we've got the La Isla Network document listed here again. All right, well, actually, it looks like we might be at time. So,
Marcel has her hand up.
Oh, sorry, I didn't see. Go ahead, Marcel.
No, just as a closing remark, we really highlight the clinician piece of climate change and the role with communities. So just so you know, you really are a trusted messenger with communities. We rely on you to communicate this information, and we hope that we're being of service to provide with resources and things that you can actually use with your patients. But we do need clinicians to get involved, clinicians to talk about climate and heat to protect communities, and you really are a trusted agent to get that information out.
Thank you. And these resources are very valuable. I know that being a clinician, time is always of the essence, and that's a lot of times a limiting factor. In a 20-minute visit, sometimes it's 15 minutes trying to get through everything the patient wants to talk about. But in addition, wanting to give that preventative guidance as well is challenging. but it's great when, someone comes in with, for instance, heart disease or asthma, and just tying that, oh, by the way, it's going to be really hot, and you're someone who's at higher risk, and here are a few things that you can do to protect yourself. And it's really nice. And I know some of you mentioned this, when there are these dot phrases that we can put into the patient take-home materials, that we don't have to spend a lot of time, but we can just tell them to go home and read that. But we're very grateful for all of your work and for being here today and sharing all of your expertise. Thank you so much. And with that, I will turn it back over to Anthony.
Thank you, Sheetal and Lucretia. Just an amazing job leading our sessions today and our audience exchange as well. And for all those, thank you for all those who provided comment as well. So we'll now welcome Grace Wickerson, who is the Senior Manager of Climate and Health at the Federation of American Scientists, to share closing remarks and key takeaways. Grace, over to you.
Awesome. Thank you so much. It's daunting to try to close out a convening of such richness and so many different perspectives, but I will surely do my best. Really just such brilliant speakers talking about the power of data and what data can elucidate, how data can be used to guide action, the data that we need, the data we have, how do we be more strategic about how we use information. There's just a lot here, and I think we are really still I've worked in this area for multiple years now, and I think I'm really excited by, regardless of the current political situation and this unrest and the challenges we're facing, I feel like people are more motivated than ever to address the issue of extreme heat. And I think creating those collaborative open spaces like this one and others are just what we really need right now in this moment. This is a problem we can solve. Every heat death is preventable. It's about finding the best and most effective strategies that protect all of the different vulnerable populations from the effects of extreme heat. So just a kind of opening reflections and thoughts before I get into the meat of my presentation. So I think we can skip forward 2 slides because it's just a panel slide. I just want to talk briefly about who we are and who I am just before we get into a couple of remarks I wanted to give around some actionable policy making and policy thinking resources we wanted to share, and then some more takeaways I want to close us out on. The Federation of American Scientists is turning 80 this year, and since our founding in 1945 by the scientists who worked on the Manhattan Project, we've been working to connect the science and technology community into the policymaking discourse, because science is such an important generator of knowledge, but scientists and technologists and researchers and medical providers are not often in the room with policymakers to share their experiences, their expertise, and the lived experiences of themselves and the people they serve. And so we think about, how do we build bridges and connections between policy and science and technology practitioners to help create platforms for action. We also believe that anyone out there can have a good idea, but turning an idea into practice is a skill and a muscle that needs to be built. And it requires a lot of adeptness and entrepreneurialness in order to help define the right moment. It takes building coalitions and partnerships. It takes working inside and outside of government. It takes maybe sometimes working internally, externally, and with the research community to drive an issue forward. There's so many ways to get the thing done. It doesn't just require, a big piece of legislation or a big executive order. Policy is happening all the time as we create the architecture of the world we want to live in. And then just a final thing that we like to focus on is we love to think about what policymakers need and want and work with them in that partnership. Because policymakers of all kinds are trying to achieve certain outcomes. And the focus is on how do we actually support actualization in the direction that addresses the issues that we're really key on focusing on, like extreme heat. So next slide. You can skip to the next slide. So I think just kind of in a quick fire hose about policy. And like I said, it's important to think about policy and how government works. This is something we love at the Federation of American Scientists, is to talk about the levers that government has. This is an example for federal, and we're starting to map out what state, local, and other regional partners have as well. But it's just important to see this full range of what government can do. Government is, again, like I said, not just making legislation and making funding. They're regulating, they're setting rules, they're setting standards, they're buying things, they are setting up systems, they are creating convening spaces, they're collaborating, and they're also an employer and an employment workforce that, on these questions of workplace standards, like could be the place where you test out, experiment, design a model way to protect workforces that work outside from heat. And so just like, obviously this is more depth than, to get into this in full depth would take probably many more minutes, but just trying to give everyone a snapshot of like what we can be working on is expansive. And many of your skills and expertise and ideas can apply in many different forums based on the political moment and the political will that we're working under. Next slide. And that's when we think about how do we build political will. I think there's a couple of things to be thinking about, and ways that the speakers in this convening today already started to feature how we work on this. So these are things we like to call like hooks, windows, and cycles. So hooks, these are, these timely stories, these timely moments where we actually see kind of this mixture between political will and a mobilization happening. Hooks are kind of usually driven by big political events. Obviously, this one that we feature here in this image was driven by a lot of the anti-immigration movement, but it has been quite effective in mobilizing these, cases and examples to drive forward the policy change that people are visioning. Windows, so as you see here, this is a part of the LA fires, but these windows are also part of these broader, extreme weather seasons that we're seeing, extreme weather events. We know they happen seasonally. We know people pay attention to them under these constraints. And so within these policy windows, what are the moments to capture attention, interest, and motivation while that eyes are on these very big events and cycles? Government works under cycles. There are legislative cycles, budgeting cycles, appropriation cycles, election cycles. These are movements that are known and can be tracked around government that allow you to figure out how exactly you can integrate an input into a process. Next slide. And it's also kind of as we think about what all these different areas of potential input and jumping in on a potential window, we also need to think about audience and how do we design policies that are relevant and applicable to these different audiences, and think again back up to that usability question. Who are we targeting and what are their abilities, to set the policy or to execute the policy? What authorities do they have? Federal, state, and local all have a range of very unique authorities, all of which can be used strategically and thoughtfully as we build the policy solutions that we're looking for. Also thinking about the type of personnel that you're engaging with, whether they're, an appointed official or someone who's a kind of a long-term civil servant. And then the ways that you're trying to convince people. Obviously, we heard today the power of stories, the power of economic data, the power of healthcare data. All of it has a different flavor, applicability, and way that you can use it to convince people to move the thing forward. Next slide. And this is just a high level way to think about case making. And I think obviously across all of our speakers, we heard different ways that they made the case or either are a part of an ongoing case making for the solutions that they're proposing, the solutions that they're working on. We like to think about it in a question-based framework. These are just like ways that you can plug and play as you think about, this ability to want to gather better heat data and, use that heat data to guide decision making. You can think, why? I think we all here on this call are pretty motivated and know why we see these preventable deaths and we want to address them. And it's also kind of creating a broader political motivation for the movement towards these solutions. By now, political motivation to act, and that's something we at FAS have been very keenly always trying to get ready for. My work is like up until April, and then there's really everything is about knowing that the political moment is attentive to the change that we're looking to see. thinking about what, the how, and the what. What do we need to actually be successful? The partnerships, the information, the policy interest, the funding, all of which we've raised today, that really are a part of that, like operating conditions that move forward policy in often, even quick ways. And the who. I think across this audience, we are the who, and we have many opportunities to continue to work together, and we can kind of be thoughtful about how we build this broad table. We build communities in, we build healthcare in, we build the private sector in, we build other stakeholders in to build a broad-based coalition. And I think on heat in particular, it's such a broad-ranging issue, and also it's an issue that in its dispersion across so many different sectors often doesn't have that one person responsible. And so how do you build responsibility and help people take ownership of the problem and identify how they can solve it together? Next slide. So just a couple again, carry on if you attended her session, it's wonderful and probably gave you some ideas. But it's just helpful even just to even think about the tools of policy implementation and the different ways that they can be used. And both of these can just, again, sample ideas, and happy to talk in more depth. But we often think about these in like behind the scenes in public. And behind the scenes is often, again, that insider strategy. How do you think about working with government and government officials in ways that move ideas, policy frameworks forward, that understand their operating constraints, their interests, the political motivations of their leaders, and help you to kind of build that rapport and build that, honestly, really structured collaboration that we really need in terms of building more community responsive and thoughtful heat policy. And then public, obviously in heat, we have very, again, attentive windows where heat is of high interest. And so we've really focused on coalition building and engaging people in a broad-based effort, and also have worked with others like the Alliance for Heat Resilience and Health that others mentioned to help kind of mobilize folks around particular windows and opportunities. Next slide. And I think I want to emphasize here that policy change is hard. It takes years, it can take decades, and can often feel really opaque, hard to understand, and especially in this moment, feel like the waters of what political will wants at a very high level are running up against the things that we want to see in the world. And how to kind of, again, is this taking this iterative, thoughtful, learning-oriented process, we can kind of be constantly working towards finding and defining a problem, by diagnosing what would actually solve that problem, designing things that are operable to the solutions that we want to see, the moment, the political will, and then iterating, developing, co-developing with others these policies. And then probably always, again, having to start right over again, define again, understand how do we move these things forward. And I think doing this with others, doing this in community is so essential. It helps to build, that a hope and kind of vision for the future that we want to see. And know that is always something that even I've been working in this field for a number of years. Like I'm still trying to identify, how does things get done, and it doesn't often feel clear. Next slide. And I just wanted to close, obviously this convening was all about data and information and how do we build this data system that allows us to track heat better, understand its impacts, and be responsive to these impacts. And this has been about a part of our organization's interest in building government capacity to address extreme heat. And we've published various briefs and reports on this. I'm happy to drop those in the chat after my remarks. But these are 5 things that have really been core as we think about governments at the federal, state, and local level, and other subnational entities that are able to address extreme heat. And we boil them down to you need leadership, you need to know what the problem is, you need to be prepared, you need to know how to respond to it, and you need to address it in the long term. These are just, obviously, all of these interests are very complex in their depth, but they're core. If we're really trying to think about a government that has the capabilities to work on this issue. And that will take all of us, and I think definitely are very interested in how we work together to move this forward. Next slide, just so I can wrap up. So I think I want to leave us with, and we heard this from John, we also heard this throughout various people's remarks, it's really important that we align around solutions that are going to protect the most vulnerable, the most exposed from extreme heat. And this is something that we're focusing on as we look ahead. What are these collaborative potential areas where we can align a lot of different organizations around solutions to address the extreme heat impacts we're seeing in communities. And all of these will take collaboration, data, research, and policy to move these forward in a collaborative way. So we need workplaces where people are protected and not exposed. We need homes and other infrastructure where people can safely exist and reliably stay cool and afford to stay cool, as folks highlighted about the rising cost of energy. And finally, we need communities that are safe, that treat heat like the hazard that it is, plan for it, build partnerships, build infrastructure that's resilient to it, and ensure that that system is set up so that every community can be heat ready. So we welcome you to engage with us, welcome you to be a part of this agenda setting effort that we've been leading. We just want it to be as relevant, accessible, and action oriented as possible. So would love to be in partnership with many of you as we think about how to engage policymakers on these critical issues with real solutions. And last slide, it's just some takeaway. I just kind of connect. That's my email at the bottom. So feel free to send me an email. I'm always happy to meet folks and always happy to connect and collaborate across efforts that I'm aware of. And you can track our work at our website and also follow us on our social media platforms at all at FAS Scientists. So thank you so much and appreciate the National Academies of Medicine for inviting me and giving me this opportunity to speak to you all. So I really appreciate the opportunity and the space that you all have created.
Thank you, Grace, for your wonderful remarks. Before moving into the speaker QA breakouts, we love your feedback on today's event. In a moment, we will be launching a brief poll. I think it's launched already, where we welcome you to share your thoughts and reflections. If you do not get a chance to finish the poll, please do not worry, as we will include a form in the post-event email for you to complete. While we launch the poll, I just want to take a moment to thank all of you for joining us today. We hope you're leaving with insights and perspectives that will inform your work and inspire action. A special thanks to the National Academies of Medicine Policy Cluster members, our strategic partners, staff, and everyone that are a part of the CCN and the leadership of the NAM Climate Grand Challenge on Climate and Health. This event really wouldn't have been possible without your dedication and vision. I'd also like to thank our esteemed speakers and panelists for sharing their invaluable insights with us today. And also just adding in on Grace's remarks, I like to end by saying that it's clear that heat impacts us all, and especially those living in communities already burdened by longstanding health and climate-related inequities. Today, we heard about the critical importance of community involvement, how meaningful engagement and collaboration with those most affected must be at the center of our efforts. We also heard about the power of storytelling and the value of qualitative data in lifting up community, patient, and organizational stories. Stories that bring urgency and humanity to the data and help shape more responsive and just solutions. We discussed the need for cross-sector collaboration and how this is a pivotal moment for state and local governments and organizations to take the lead and develop equitable, sustainable responses. We also heard about the importance of using heat-related data in both traditional and non-traditional settings to inform strategies, interventions, and policy. And of course, we covered so much more. It's clear that the time to act is now, and the path forward must be rooted in equity, collaboration, and community voice. There is truly so much to work for and even more to build together, and we look forward to continue this work together. Thank you again for our panelists for such a rich discussion, and we'll now move into our speaker Q&A breakouts. All right. Thank you. All right, so for these breakout sessions, for this breakout session, each speaker will have their own room, and attendees will be able to self-select the rooms they like to visit. You can self-select the breakout rooms using the breakout room icon on the control panel at the bottom, and you're welcome to move about the rooms as you please, though we encourage you to spread out. These rooms are designed to give you additional time to direct exchange and learning, and we encourage you to ask questions and share your thoughts with our speakers. Please note that we will be stopping the recording before opening the breakouts. And finally, if you encounter any difficulties with Zoom, please do not hesitate to ask for assistance in the chat. Without further ado, we'll go ahead and open the breakout rooms.